Hi, this is Vanessa from Cable TV. We're ready for an
Yeah,
audio check.
Back up from yesterday, thank you.
Okay. Hi, this is Vanessa. We're ready for an audio check. Hi, we're ready for an audio check. If you don't mind counting down from 10 for us.
Yeah, not a problem. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Thank you so much.
Thank you.
There's no other council members here. Everyone's going to housing today.
Cable, are we ready?
Yes, sir, we are ready.
Nice to hear your voice today. Sorry to keep you all waiting.
No
Um,
worries.
All right, well then we're gonna get started. I could wait until noon and start. Wait. I'm calling to order this hearing. This is a public hearing of the Committee of the Whole of the Council of the District of Columbia. I'm Phil Mendelson, Chairman of the Council and Chair of the Committee of the Whole. Today is Wednesday, November 30th, 2022. The time is 11:58 in the morning. And this hearing this is an oversight hearing, and it concerns attendance, chronic absenteeism, and truancy in the district. The stated purpose of this oversight hearing is to receive testimony from government witnesses and partners, including the Office of the Deputy Mayor of Education, the Office of the State Superintendent of Education, the District of Columbia Public Schools, the Public Charter School Board, the Child and Family Services Agency, all regarding the district's efforts to improve school attendance. Over the past decade, public schools have worked diligently on this issue and have had little progress in reducing truancy. The hearing will also be an opportunity for comment, if any, on the new 60-40 rule. That actually may be a holdover from the last notice because that got changed. Actually, that is what the new rule is. So witnesses may want to testify about that or comment on it. The committee is interested in hearing new approaches that will actually reduce truancy and chronic absenteeism. The hearing will build upon the Committee of the Whole's continued oversight on this issue and previous hearings on twice in 2019, once in 2021, and in March of this year. Yes, we also had a hearing in December of 2021. The record in this matter will close in 2 weeks. That is at 5 p.m. on Wednesday, December 14th, 2022. So anybody who wants to submit comments or testimony, I'll look at it at any time, but for inclusion in the record, it has to be submitted by 5 p.m. on Wednesday, December 14th. I apologize for our starting so late. The council is approaching the end of council period 24. And there's a lot happening in terms of legislation and requests from members. And so I apologize. What I'm going to do is I will call the non-government witnesses first, and I'll break them in half, break them up into two groups. And then we'll have the government witnesses. The government witnesses will come at the end, and they include the state superintendent and the Office of the State Superintendent of Education, the Deputy Mayor for Education, the President of the State Board of Education. There's one representative from DC Public Schools, a representative from the Public Charter School Board, as well as representatives from Child and Family Services Agency, the Office of Victim Services and Justice Grants, which runs the Show Up Stand Out program, and a representative of the Office of the Attorney General. That's at the end of the hearing. So let me call the first 9 witnesses. Danielle Robinette, who's with Children's Law Center, Manitra Martin, who is with Education Reform Now, Rachel Johnston, who is Senior Director of Operations at the DC Charter School Alliance, Teo Bell, who's with the School Justice Project, Josh Boots with Empower K-12, Salim Adolfo, who is a Advisory Neighborhood Commissioner and Chair of ANC's 8C, Chelsea Coffin, who's with the DC Policy Center, Danielle Dooley, who's with Children's National, Kyla Reed Witt, who is listed as being with a PAVE parent, Chantel Williams, who's representing Friendship Tech Prep. She's Director of Student Support Services. Rebecca, I went farther than I meant to. We'll stop with Chantel Williams. So let's see who's here. We're pausing while letting folks in. We're still letting folks in, but why don't we start with Miss Robinette, who will be followed by Mitra Martin. I don't think I said how long folks can testify, but let's try for 3 minutes, and if you need a little bit longer, I won't cut you off immediately. I can't hear you.
Am I good?
I can hear you now.
Excellent. Good afternoon, Chairman Mendelson, council members, and committee staff. My name is Danielle Robinette, and I'm a policy analyst at Children's Law Center and a former public school teacher. I am testifying today on behalf of the Children's Law Center, which fights so every DC child can grow up with a stable family, good health, and a quality education. We would like to thank Councilmember Trayon White and the committee for bringing much needed attention to this important issue. Earlier this year, we testified regarding the School Attendance Amendment Act, which sought to amend the current definition of present and reduce the number of students harmed by the 80-20 rule. At that hearing, OSSI opposed legislating on this issue and promised to make the necessary changes before the start of SY 22-23. We were glad to see the agency work diligently and expeditiously alongside the state board to ensure that emergency regs were in place for the new school year. The children and families we work with often face myriad challenges in attending school that stem largely from a lack of resources. Unstable and fluid living situations, unreliable transportation, unsafe routes, health concerns, and familial responsibilities all serve as barriers to regular school attendance. In these cases, punitive consequences do not improve attendance because they do not address the underlying barriers. As such, we support the use of student support teams to create individualized solutions to address a student's barriers to attendance. However, insufficient resources have led to SST meetings that are brief and superficial. For schools to implement SSTs with fidelity, they will need both the human and capital resources necessary to create meaningful SST meetings. Moreover, the 80-20 rule is just a first step in the work necessary to improve the regulatory landscape governing school attendance in DC. We encourage the committee, the deputy mayor, the education agencies, and advocates to continue collaborating to identify and remove other punitive attendance policies. For example, DCPS's failure due to absence policy creates the same problem as the 80-20 rule. Under this policy, a DCPS school cannot promote any student who accumulates 30 or more unexcused absences within a school year. Like the 80-20 rule, the failure due to absence rule disincentivizes students from attending school by communicating that there is no point in attending school once they have missed 30 days. We urge DC's education sector to move away from punitive responses to chronic absenteeism and instead focus efforts on supporting students and families and overcoming barriers to attendance. I appreciate this opportunity to testify, and I welcome any questions. Thank you.
Thank you. Ms. Martin?
Good morning. My name is Minitri Martin. I'm a Ward 4 resident, former classroom teacher, and community organizer for Education Reform, now DC. Though chronic absenteeism has increased among DC students, data shows that it is primarily due to excused absences related to COVID. However, areas that were present pre-pandemic still persist. For example, middle school students, high school students, students designated as at risk, and students of color still show high rates of chronic absenteeism. Additionally, OSSE's teacher and principal retention report highlights the correlation between school leadership and student attendance. These reports are devastating, and based on conversations with parents, students, and community advocates, I can attest to the impact of this data. In my previous testimony, I recounted the story of one parent who was reported to CFSA after a substitute teacher confused their child with another student. Additionally, a second parent disclosed to me the trauma their child experienced around attendance after being attacked by a group of students on and off school grounds. A third parent reported that their child was terrified of the behaviors of students experiencing mental health issues. And in a more recent conversation, a DC student affirmed that the school environment, mental health issues, the absence of teachers, and student behaviors make getting up for school much more difficult. Attendance advocates also pointed out the lack of resources allocated to 7th and 8th grade students and families, which has often resulted in students dropping out by 9th grade. None of these stories are okay. And, we all have a duty to be relentless in maintaining families' trust, and that includes keeping students safe and in schools. As a community, we must ask, how can we make school more meaningful for students? We offer one overarching solution and 4 ways to achieve that goal. Simply reimagine how we make school more joyful and meaningful for students. Recently, 2 8th grade students and 2 school leaders were individually interviewed by me. One student had nearly perfect attendance, while the other student attendance was unsatisfactory prior to the school year. When asked what was the one thing that motivated them to attend school, they both stated, knowing the importance of education and the role it plays in my future. Additionally, both adults said their most effective conversations were about why school attendance was important for the student's future. Every adult in this room today can agree that motivation to achieve any goal begins with understanding its importance. And for the sake of this time, I conclude my testimony with a list of ways to reimagine how we can achieve making school more joyful and meaningful. First, continuously aggressively investing in safe passage efforts so that we can prevent gun violence, traffic fatalities, and bullying. Second, continue addressing the mental health crisis by supporting sustainable funding and improve implementation of the school-based behavioral health program. Third, take advantage of the multi-million-dollar investment from the XQDC Institute for 2 DC high schools by prioritizing attendance in the plans to reimagine high schools. And last, consider using relief funds to provide financial incentives to 7th and 8th grade students to help rebuild student attendance habits. For more information on these solutions, I encourage you to check out my full testimony, and I welcome any questions you may have. Thank you.
Thank you, Ms. Martin. Rachel Johnston?
Good afternoon, Chairman Mendelson and members of the committee. My name is Rachel Johnston, a proud Ward 5 resident and the Senior Director of Operations and School Support for the DC Charter School Alliance, the local nonprofit dedicated to ensuring all students in DC receive the great public education they deserve. Our priority is ensuring all students are in class. We know academic proficiency is linked to attendance, so we're grateful the Council is drawing attention to barriers that make consistent attendance a challenge. We're also appreciative of the State Board of Education's new 60-40 attendance regulation, which incentivizes students to come to school even if they miss part of the day. Prior to the DC Alliance, I worked at Kingsman Academy, a Ward 6 public charter school specifically designed to support students at risk of dropping out of high school. What I learned at Kingsman is that punitive measures rarely work because absenteeism is often an expression of a student's unmet need. But engaging families regularly to surface those needs was more difficult during the pandemic. So as our city finds a new normal, school leaders are dedicating more resources to home visits and in-person interactions to foster trusting relationships and identify ways to navigate attendance barriers. Some use vans or contract with rideshare organizations to make it easier to get to and from school. Several operate food and clothing pantries to ensure students' basic needs are met. Others incentivize high attendance with gift cards or prizes. One school noticed their students' disconnection to school was due to inconsistent access to a working phone, so they invested in cell phone lines for their students. Flexible interventions like these are immensely effective, but are also staff and cost intensive. As we work together to equitably address the root causes of truancy, we have 3 recommended courses of action. First, it's clear family engagement is key to better attendance. So we hope to work with the council and mayor in the coming budget cycle to ensure schools have sufficient resources to continue staffing these critical family engagement roles after pandemic federal funds expire. Second, schools need more support to meet students' mental health needs. Schools have struggled to hire and retain high-quality clinicians. There are also vacancies across DBH's school-based behavioral health program. We support the goals of the Strengthening Families Coalition and advocate for innovative recruitment strategies like behavioral health degree pathways. And finally, we need solutions that provide reliable and safe transportation for students. While Kids Ride Free helps some students get to and from school, it does not work as a one-size-fits-all solution because many families, especially those living in wards 7 and 8, cannot easily access public transit. We advocate for DC to establish transportation grants similar to Arizona's Transportation Modernization Grants Program. Grants could be offered to nonprofits, schools, and government agencies to create a more flexible, collaborative transportation system that is inclusive of all public school models and student needs. The DC Alliance and public charter school community care deeply about attendance challenges and are ready to partner with you on ways we can creatively support students so they can actively and consistently engage in school. Thank you for your time and attention to this matter, and I welcome your questions.
Thank you, Ms. Johnston. Theo Bell.
Good morning, Chairman, and thank you for the opportunity to testify. My name is Theo Bell, and I'm the Senior Staff Attorney at School Justice Project, SJP, as well as a Ward 4 resident. SJP is a DC-based legal services organization that provides special education representation to older, ages 17 through 22, court-involved students with disabilities. SJP is pleased to offer testimony today to thank OSSI and the council, and specifically Councilmember Tran White, for their leadership in finally bringing an end to the pernicious 80-20 rule this school year. Councilmember White's Bill 24-428, the School Attendance Amendment Act of 2021, first introduced the idea of a change to the 80-20 rule to a less severe 60-40 split. Importantly, the bill also provided for a valid excuse if there was a verified delay of transportation, public transportation, that exceeded 10% of the instructional day. These governing concepts of how to reform attendance regulations in the district found great support in OSSI Superintendent Dr. Grant. The council's pressure on OSSI to rulemaking in a swift manner on regulations to address not only the return to in-person learning, but also to address the novel issue of distance learning for all students should be applauded. While many advocates, including SJP, were disappointed to learn that the excuse for transportation delays was not ultimately adopted by OSSI, especially in light of the well-documented WMATA failures throughout the pandemic and following, we were very pleased that OSSI chose to rulemaking on several specific issues which have impacted attendance in the district. Given SJP's direct representation legal work, we were encouraged that OSSI's first proposed rulemaking recognized the need to excuse absences based on a student's participation in a judicial or administrative legal proceeding where the student was a named party. Court-involved students may have frequent court dates, which require them to miss significant instructional time. These students may also have supervision reporting requirements, which may occur during school hours. Some students may be required to submit to GPS tracking, requiring the placement of an ankle device, typically immediately following a court hearing, or in other words, during school hours. In some cases, the court may require an off-site evaluation of a student. These are often students who frequently have issues with the school attendance to gain a better understanding of their needs. Yet these evaluations also happen during the school day and result in more absences. We asked OSSI that in its second iteration of the rulemaking that it expand the absence excuse to include other events related to a student's court involvement, and we are pleased to report that OSSI did so. Nonetheless, SJP would have liked to see more focus on adult students who, upon turning 18, become their own educational decision makers. For example, the regulation should have required students to make efforts to contact the schools to make efforts to contact the student and not just the parent or guardian when the student was at risk of being marked absent. Similarly, the regulations should have explicitly allowed for adult students to provide for an absence excuse for their school without being silent as to whether the excuse could only be provided by a parent, guardian, or for a court-involved student by their attorney. Overall, though, we are pleased with the attendance regulations and we thank Council and OSSI for their leadership. Thank you very much for the opportunity to offer SJP's testimony today, and I'm here to answer any questions.
Thank you very much, Ms. Bell. Josh Boots?
Good afternoon, Chairman Mendelson and staff and members of the committee of the whole. My name is Josh Boots. I am the Executive Director of Empower K-12, a local nonprofit focused on education data and supporting schools to rapidly improve the academic and social emotional well-being of DC's priority student populations. Student absenteeism rates so far in the 2022-23 school year have improved from this time last year, but remain significantly higher than pre-pandemic rates. In May 2022, we collaborated with 26 schools serving 8,700 students to analyze student absenteeism data, identify bright spots, and learn from their promising practices. We organized an information sharing session focusing on 2 schools with the lowest absenteeism rates in last year, Statesman Academy and Friendship Woodridge, which also had 2 of the 3 lowest rates of absenteeism for students designated as at risk pre-pandemic. Here's what they told us works for them. Focus on therapeutic relationships with students and families. Bright spot educators utilize a problem-solving first approach to understanding root causes and prevent attendance, and then create individualized pathways to success. They also commit to the hustle. Improving student attendance requires relentless follow-up with families and students, including a willingness to locate students at 3 to 4 known associated addresses to demonstrate their level of care and their interest in having that student at school. They also celebrate students. Statesman gives students school arrival the red carpet treatment with a DJ'd student dance party and name announcement daily. Friendship Woodridge uses social media and morning announcements via Zoom to celebrate student attendance. They also model the importance of attendance from the top down. The Bright Spot schools emphasize that school leader and teacher attendance as a key factor to demonstrating the importance of being at school to their students and families. This school year, Empower K-12 is piloting a chronic absenteeism early warning model with 3 public charter school LEAs representing approximately 6,800 students. The robust early learning model and dashboard help attendance interventionists understand which students need additional support early in the year, and it helps educators quickly and accurately know when their interventions are moving the needle. For example, the model assists school leaders with deciphering when a student absence is just a normal sick day, or when it may be part of a pattern that leads to chronic absenteeism. The early warning model, however, is not designed to assess the root causes behind student absenteeism. For that, our setting needs regular whole child surveys of students, educators, and parents that ask about physical health and safe passage, alongside the social emotional issues that can affect student attendance. We strongly encourage the council to draft legislation that leads to the design of surveys that include our community's voice during the 22-23 school year 23-24 school year with a full citywide implementation during the 24-25 school year. The legislation should focus on identifying bright spots, learning what strategies work, and then spreading that information broadly. Thank you for the opportunity to testify today, and I look forward to answering any questions you may have.
Thank you, Mr. Boots. Commissioner Adolfo, is he here? Kelsey Coffin?
Good afternoon, Chairman Mendelson and members of the Committee of the Whole. My name is Chelsea Coffin, and I'm the Director of the Education Policy Initiative at the DC Policy Center, an independent think tank focused on advancing policies for a growing and vibrant economy in DC. I'm testifying to provide context on attendance and chronic absenteeism, as well as to present the case for more data published with greater regularity that can support research on improving attendance. How much school students attend is a strong indicator of student well-being and future academic success, making it a critical metric to track and understand. In DC, during the virtual school year of 2020-21, even with relaxed attendance requirements, 31% of students were chronically absent, up from 29% in 2018-19. Among high school students, 35% of students were chronically absent, and among students designated as at risk, this share was 48%. And in Empower K-12 sample of 10,000 public charter school students indicates a chronic absenteeism rate that is 10 percentage points higher than pre-pandemic for the last school year. Recorded attendance in school year 2020-21 suggests that students lost significant instruction time during an already challenging virtual school year, and school year 21-22 does not show early signs of a rebound in attendance. Attendance is a key sign of recovery from the pandemic, as it shows the extent to which students are present and able to learn. To address attendance issues, we need better data in real time and research to look into the underlying reasons why students are absent. To improve data, it would be helpful to both understand the reason for absence and to have more frequent reporting during a school year. Especially during times of heightened COVID-19, flu, and RSV, the system should report whether absences are due to illness or otherwise, which could mean that policies to improve transit, public safety, or general engagement could make a difference in reducing absenteeism. It would also be helpful to have a public-facing dashboard at the state level with updates monthly on in-seat attendance, chronic absenteeism, including the share of students who are severely chronically absent, having missed 20% or more of the school year, and truancy during the school year at the system level so that attendance issues are apparent before it is too late to address. Finally, more research is critical into why students are absent in DC and what can be done in our context to improve attendance as well as the implications of absences on learning. This could be undertaken as part of the DC Education Research Collaborative's draft research agenda, which includes one focus area around success after high school and one around supportive school environments. The Detroit Education Research Partnership, for example, has done a deep dive into this topic, looking into Detroit's families' experiences with COVID-19 and school attendance, why students in Detroit miss school, and factors like geography that matter the most for attendance for Detroit students. In DC, the Mid-Atlantic Regional Educational Laboratory, or REL, has one study already about attendance in DCPS schools, finding a small impact of less than 1% on attendance for students who received a home visit. It is a great start, but there is more to be done locally to figure out what could reduce absences in DC. Thank you for your time. I look forward to answering any questions you may have.
Thank you, Ms. Kaufman. Danielle Dooley.
Good afternoon, Chairman Mendelson, members of the committee and staff. Thank you for the opportunity to provide testimony today regarding student attendance. My name is Danielle Dooley, and I'm a pediatrician, a Ward 2 resident, a parent, and a medical director of community affairs in the Child Health Advocacy Institute at Children's National Hospital. Children's National is an integral part of the fabric of this region, serving Washington, D.C.'s children and families for over 150 years. And we are committed to working with our education partners. And our vision is that Children's National is a school-friendly health system designed to help all children reach optimal health and achieve their full academic potential. We know that school attendance is critical for children's health, and we know that school attendance directly impacts health and educational equity. While schools have now reopened, many of my patients are still struggling to establish strong attendance patterns. I think of my 16-year-old patient who is still trying to process the loss of family members due to COVID-19 and has anxiety and panic attacks that cause her to miss school on a regular basis. My colleague, Dr. Claire Bugard, a pediatrician at the Children's Health Center at the ARC, cares for a family where the children have had extended absences from school due to fears of both the virus and the vaccine. These experiences illustrate why the medical and education sectors must partner to support student attendance. At Children's National, we're working to provide accessible healthcare services that reduce student absences and remove barriers to care, such as weekend and evening appointments in primary care, telehealth in primary care, mental health, and subspecialties, and through funding from the United Health Foundation, a robust mobile medical program led by my colleague, Dr. Hope Rhodes, to deliver primary care and immunizations at schools and sites throughout the city. In addition, with funding from the United Health Foundation, we're expanding a novel program, the Chronic Absenteeism Reduction Effort, or CARE, in partnership with DCPS and OSSI. This program allows parents at 14 DC public schools to consent to share their child's attendance data with their healthcare provider. We can then provide specialized outreach and support to families to help them navigate barriers to attendance. Since 2021, we have supported over 100 families and by connecting them to medical and social resources and supports. These efforts really illustrate the importance of cross-sector data sharing. We cannot support families if each sector is operating in a silo, and critical to breaking down silos is investment in data sharing. The health sector wants to actively partner with and support our education colleagues in improving student attendance, and we must continue to invest in data sharing, also including a system for electronic transmission of universal health certificates from the pediatric provider's office to the school system. We look forward to continuing to work together, and thank you for the opportunity to testify today, and I'm happy to answer any questions.
Thank you, Ms. Dooley. Carla Reed-Witt. Is she here? Yes. Carla Reed-Witt. There you are.
Yeah. Okay, sorry about that. All righty. Hi, my name is Carla Reed-Witt. I'm an education, disability, mental health, and literacy policy advocate, as well as a PAVE citywide board member. PAVE stands for Parents Amplifying Voices in Education. 1 in 6 U.S. youth aged 6 to 17 experience mental health disorders each year, and half of all mental health conditions begin by age 14. Attention deficit, hyperactivity disorder, behavior problems, anxiety, and depression are the most commonly diagnosed mental disorders in children. Untreated or inadequately treated mental illness can lead to higher rates of school absenteeism, school dropout, unemployment, substance abuse, arrest, incarceration, and even early death. For some children and teens with anxiety disorders, depressions, or mental health diagnosis, school can become so overwhelming that they frequently struggle to get to school on time or at all, stay at school, or be engaged in school activities. I don't believe that our 60-40 rule or the potential carceral implications for parents and for students considered absent or truant truly contemplate these kinds of circumstances. Think of a college student who has a mental health challenge that interferes with school participation. That student can opt to take a semester off. That is not an option for students through age 18. They are legally compelled to attend school even when struggling with complex mental health challenges. Because DC does not have a complete children's mental health infrastructure continuum, children who have been in crisis and been hospitalized are forced to go back to school without intensive outpatient services that will keep them from missing school or going back into crisis. This year, all LEAs were required to implement a home and hospital program, or HIP. HIPs cover students in mental health with mental health crisis, but more needs to be done to monitor and support schools to properly implement HIPs in a timely manner with appropriate academic services. It must be clear to LEAs that regs state that they are required to approve services upon receipt of appropriate documents and that they may not delay approval. Advocates have expressed concern regarding this behavior by LEAs, as well as HIPs, as students in HIP not receiving their full complement of services as required by their IEPs. To that end, we need to continue to fully fund school-based mental health programs and simultaneously implement innovative solutions to school-based mental health while we build our provider pipeline. Look closely at what support schools need to develop and implement robust home and hospital programs, and vigorously oversee both of these. We also need to assess the impact of the 60-40 rule and the 30-day absent class failure rule on students with mental health challenges for unintended consequences. We must move with urgency to create a robust citywide continuum of children's mental health services for both privately and Medicaid insured children. All of these should be part of a citywide plan to combat student mental health, student absenteeism, and truancy. Thank you for your time.
Thank you, Ms. Reed-Witt. I don't have a copy of your statement. Could you provide that, please?
Yes, I will. Thank you.
Thank you. Chantel Williams.
Greetings, Chairman Mendelson and members of the Committee of the Whole. Thank you for this opportunity to testify. I'm Chantel Williams, and I'm honored to serve as the Director of Student Support Services at Friendship Technology Preparatory Academy in Ward 8. Friendship is the third largest LEA in the District of Columbia and serves nearly 5,000 students located in wards 4, 5, 6, 7, and 8. And our school currently serves 358 of the best high school students in the district. In reviewing the attendance report for school year 2020-2021, Friendship Tech Prep dramatically outperformed the state average in chronic absenteeism, truancy, and in-seat attendance, and I'm excited to share how we've achieved this. First, we make attendance a priority. Students who are absent are not learning. We take that personally and we take it seriously. This is their future. Additionally, we understand that it is a journey. We don't accept that the choices that a child makes today are the same choices they will make tomorrow. Kids make mistakes, but they can learn and they can grow. As educators, we have to believe that. And because we believe it, we don't give up on kids, not even the ones who are the hardest to reach. Beyond these two beliefs, the following strategies are important. We have strong attendance systems and systems for communicating about attendance. You don't miss school at Tech Prep without someone noticing and taking action. We execute consistently and as a team. Strong systems are not meaningful if they're not executed with fidelity. We hold ourselves accountable to this. We invest in strong relationships with our scholars and our families. We do home visits, we make phone calls. When kids miss school, we check in with them and make sure that they're doing okay before they go back to class. We have a joyful culture and promote engaging programs. The world is competing for the attention of our scholars. It's hard to compete with video games and social media, but we do it. We get our kids excited about their futures, help them believe in the great things they can achieve for themselves, and we inspire them to show up. We incentivize good behavior with monthly rewards for good attendance. The help we need is not easy because the reasons our kids miss school are big and complicated. But if you want more kids to go to school every day, especially in communities like ours, reduce the daily violence and trauma our kids experience, reduce the poverty our kids experience. When your daily life is touched by violence, trauma, and poverty, you're less likely to make attending school a priority. Improve the environmental health conditions our families experience. We have many students with chronic health conditions, especially asthma and other respiratory conditions that keep them out of school. If our kids are unhealthy, they're less likely to be able to attend school. Improve supports for families. As a high school, we have many students who are regularly missing school because they have to provide for their younger siblings. It isn't right and it's not fair, but it is a position that many of our families find themselves in from time to time. In closing, and to bring a bit more student voice into the conversation, here are a few quotes from some of our Tech Prep scholars. I wanted to show you all that that wasn't me. The person that everyone thought I wanted to turn it around and show you something new. It's hard to explain. You helped by staying on my back and the rest of the administrators. I also wanted to play basketball this year, so I had to get my grades up for that. I don't like being at home. I want to go to college, so I come to school. You all reminded me that having too many late days would cause me to fail, and I don't like failing. And now I'm on the honor roll. Ms. Shaw's my #1 supporter. Ms. McLaurin and Ms. Cook are my top 3 that help me to stay sane, change my behaviors, and not act the way that I used to act. Thank you all for your time, and I welcome any questions.
It's a great afternoon here, Friendship.
Thank you, Ms. Williams. Don't go away because I think I'm going to start with you, Ms. Williams. I have a few questions. I'll begin with this, Ms. Williams. I don't have a copy of your statement, so if you could provide that, that would be great.
My apologies, there's an announcement happening. I apologize again. Could you repeat the question, please?
Well, the first one is, I don't have a copy of your statement. Would you provide that, please?
Yes, sure.
Because there were a lot of interesting ideas there. One of the earlier witnesses testified that one of the things we should do to improve attendance is to pay students. I don't think you mentioned that in your list of strategies that Friendship's doing. What do you think about that?
I do believe that we are in a time where students need more than the typical motivation that many of us may have needed coming through high school. I do believe that we, as a society, have promoted the idea that, you know, it's important to show up in order to get paid. It's important to have something that makes what you're doing worthwhile. And if in some cases, if it is necessary to provide some sort of incentive, I don't know if monetary might be the most feasible or economical. However, I do believe that incentives are a great motivator for students. And we've seen that here at Tech Prep. We incentivize students by hosting events that we know that they're going to want to participate in, having trips that they're going to want to participate in. Even creating different sweatshirts and Tech Prep swag, if you will, that they are proud to earn and wear because it helps to show their school spirit and it helps them to feel like they do belong, which is another factor that sometimes deters kids from wanting to participate and be here at school. So it helps to create a sense of community while also incentivizing students to want to be here and show improvement and growth and consistency with coming to school.
Thank you. And please do get us your statement. So I have a few other questions for other witnesses. Where do I want to begin? Ms. Johnston.
Yes.
You talked about mental health.
Yes.
Now find your yes. And I actually wanted to ask both you and Dr. Dooley about this. So you testified about the importance of meeting students' mental health needs. I think everybody agrees with that as being important. We, the council, put money in the budget to try to increase the number of mental health clinicians. What more can we do?
So my understanding is that there's actually just a shortage of qualified quality clinicians in the city. And so, for example, there are so many schools across the city signed up to participate in DPH's program, but many of the CBO partners have vacancies. And so it's not that there's not a need and a structure set up, but it's just finding the qualified clinicians. And so one of our suggestions was the behavioral health degrees pathways as a way to bring more qualified clinicians into the city to fill those vacancies.
Now that bill, which you cite, in fact, it's 24-1019. That means it was only recently introduced.
Correct.
So I'm not familiar with it and it probably wasn't referred to committee of the whole. Is that trying to set up a pathway through UDC or another school institution?
It was to set up behavioral health degrees programs at UDC and then bring more people through that program to be licensed here in the district.
Okay, now usually when we've done something like this, and we have done pathways at UDC for like nurses and childcare educators, there's a what do I call it, a ramp up time. So that doesn't get us a quick solution.
Yeah, we recognize that the behavioral health degrees pathways option is a longer term solution.
Okay, so this sounds critical and I don't mean it that way, but you're giving us a solution that we can't do anything about right away. But let me ask Dr. Dooley, because you touched on this as well. Does children provide mental health professionals?
Yes, thank you for the question. And I definitely concur with Ms. Johnston's point about needing to have both shorter term and longer term solutions. I'm fortunate to practice at Children's National, where we have worked really hard to integrate mental health care into our primary care health centers. So for example, in the health center where I work at Columbia Heights on 14th Street, we have a co-located psychologist as well as psychology fellows who are under the supervision of our lead psychologist. And so when we identify families who have a mental health concern, I'm able to do a variety of things, including sometimes it's a discussion with a psychologist about what might be the next best step. Sometimes it's referring directly. And as Ms. Johnston said, we also really work to refer people to their school-based mental health program if that if there's someone located in the school, because that helps support student attendance and doesn't cause students to miss as much school. So the co-location of psychological services and mental health supports in primary care has been really critical at Children's National, especially as we are seeing the challenges that families face in recovering from the COVID pandemic and the challenges that they've experienced.
Do you have any thoughts on how we deal with the shortage of mental health professionals?
I think there are a couple of ways we could think about it. I know at Children's, we are always working to increase the training of our primary care providers so that we can become more comfortable handling very common childhood mental health conditions, as well as more familiar with very brief interventions that can be conducted in primary care. So certainly support for empowering and educating the primary care workforce is critical. I also think that Children's has really worked to think innovatively about how to use its limited resources. So for example, for psychiatrists in primary care, we now have access to 2 Children's National psychiatrists who have open office hours where we can drop in and discuss a patient case or concern and get advice on the next steps. So even though that may not immediately connect a family to care, it really helps us to start formulating a plan for and with that family by having that access. So really trying to be flexible with the limited resources that we do have.
I think one other shorter term solution that I didn't mention in my testimony, but something worth exploring is reciprocity across Virginia and Maryland, so that already licensed health professionals can practice within DC schools.
Thank you. I'm going to keep moving along here. Ms. Coffin, Chelsea Coffin. This is actually, I guess I had a request and then a question. Would you be willing to update the bar graphs that you have in your testimony to reflect the 21, 22 data? It just came out.
Yes, I can do that.
That would be great. I love bar charts sometimes. Thank you. Now, you also in your testimony, you said it'd be helpful to improve data. It would be helpful to understand the reason for absence and to have more frequent reporting during a school year. There's a truancy task force, which is now called Show Up, Stand Up, no, Everyday Counts. They talk forever about data. Why do you say we need more data?
I think if the Truancy Task Force has this information, they're the ones who are the best equipped to have these conversations. I don't think that there's any information that's available to the general public, or maybe I need to do a better job looking at the Truancy Task Force throughout the school year. And it seems like we don't have information on attendance until, kind of until the school year's over. Schools know, teachers know, and they're doing everything. But I think to draw more attention to this issue, it would be helpful to have more of a regular dashboard on attendance and other metrics as an indicator of recovery from the pandemic and the extent to which students are engaging with school.
Well, the task force is now called Everyday Counts. And it's run through the Deputy Mayor for Education's office. I don't know that they are collecting data in real time, as in why are kids absent in the month of November of 2022, but they have done quite a bit of survey work why kids are absent. And the statement in your testimony makes me think you're unaware, which is either you haven't checked them out or they are not very public with their information.
I'll definitely take a look right after this.
Okay. Thank you. Mr. Booth, in your testimony, you mentioned at the bottom of page 1, emphasizing that we need to get more information about the root causes behind student absenteeism. I don't know that you meant that so much broadly as on an individual basis, or maybe you meant broadly. In any event, my reaction when I heard you say that was, Isn't this what the student support teams, the SST, should be doing?
Yeah, I mean, yes, I think they do at places where attendance and chronic absenteeism are being curbed. They're doing it effectively. What we don't know is what are those interventions being done in place. To kind of go off your previous question to Ms. Coffin, like some of the data that we don't have access to is what interventions are we trying and what interventions for what particular root causes are effective. And so we don't have that sort of like link between like what is the root cause for this child not attending? What is the intervention that we tried and did it work? Yes or no? We don't have that sort of like maybe individual schools or individual educators or individual attendance counselors have that information for like a few students, but district wide we don't. And so it's about sharing that data, collaborating, collecting it at that granular level that can actually potentially move the needle forward.
I think I'm a little confused. And where I wanted to go was to talk more about SSTs and then ask Ms. Robinette about it. I'm a little bit confused, I think, because there's been over the years a lot of studying of why kids are absent. And well, I don't have it at my fingertips. I think we have a pretty good idea of the main reasons why kids are absent. Some of it is transportation, some of it is mental health issues with the parent, some of it is trauma in either the home or in the environment. And that's not meant to be all of the reasons, but we have a pretty good idea why. Where I think we are falling down, and we as a system, is that we're not doing this on an individual basis, which is what the SST could do. Which is why I started out with my question to you of shouldn't the SSTs be doing this? I mean, we could try to quantify to the precise degree how many kids are 10 days late because of transportation problems or 20 days late because of transportation problems. But we already know that transportation is important and that it is a factor. But the goal of all this is to get Johnny, just to pick a name, to be in school. And so why is Johnny not in school? And maybe Johnny's not in school because of transportation, or maybe it has nothing to do with transportation at all. And that's where we seem to be falling short, is that we're not applying what we know about the causes in general for absenteeism, not applying that on an individual basis. Am I making sense?
I mean, I think you're definitely making sense, right? We do broadly know what most of those reasons behind those root causes can be from historical data, but we don't know to the extent to which they are true today. Like some of them might have they're shifting in terms of what those actual reasons are. Maybe it's a citywide transportation problem. Maybe it's just one bus route. But again, we don't know without asking and having some sort of like whole child survey that we're doing regularly that assesses, is it just, and I know that SSTs are doing this like at the individual student level, they are, but at the extent to which it's like more of a problem at one school for one student versus citywide, we do not know.
Well, let me shift to Ms. Robinette. I always love it when people say at a hearing, well, we need to spend more money, which is kind of what you did. But I think there's something here. You said we strongly recommend the council provide the resources necessary through funding and staffing positions. Insufficient resources have led the SST meetings that are brief and superficial. We encourage the council to provide funding for SSTs to be organized by an individual with case management experience. I don't think it's as simple as providing money, but I do think the SSTs in some schools are overwhelmed and therefore completely ineffective. And that's one of the questions that I have for the executive is, what are you doing to solve that problem? And I don't know if there's an easy answer there. So let me say a little bit more. When after the South Capitol Street shootings, which some of you may remember in 2010, Councilmember Catania, who then chaired, I believe it was the Health Committee, put forth legislation that is called something like the South Capitol Street something.
Memorial Amendment Act.
Yes, thank you. And it deals with the issue of absenteeism. And in there is a requirement for SSTs. In the bill, when we adopted it, was not funded. And since then, we have funded it. So DCPS has been funded for its SSTs. There's kind of an irony there that we're talking about how, well, maybe they don't have enough money when they said that they had what they needed to fund the bill. Be that as it may, I think of a school like Baloo maybe, where the number of SSTs they have to have is in the hundreds. And that's just got to be overwhelming. If you take another school, like my daughter went to Eaton Elementary, and they may have had a half dozen SSTs in the course of the year. And that's completely manageable. For those who don't know, the SST is supposed to have the teacher, the principal, counselor, maybe a couple other professionals, the student and the parent. And they talk about why the child is absent. So that's getting pretty specific about the causes. So, Ms. Robinette, I'm putting it on you. How do we solve this problem of getting enough SSTs, or should we find an alternative?
Thank you for this question. I think this is really important, and I think there are a lot of things we can do. First, I want to acknowledge that the change from the 80-20 to 60-40 rule will, in fact, diminish the number of SSTs that are required. So the amendments that they made changed it to full day absences. So students who are chronically tardy will then be different from students who are missing the full day all the time. And students missing full school days will be referred to SSTs. So that will already reduce the number of these meetings that they need to have, and hopefully allow schools to have more meaningful conversations with students. But that's just a first step. Anecdotally, from our client experiences, we often see that these SST meetings are just kind of like checking a box, because as you said, certain schools have to do thousands of these. It's not hundreds, it's thousands. We had data, I believe that was from the EDC task force, but it's pre-COVID, that there were some like 10,000 meetings that had to happen in that school year. And of course, they're not equitably distributed across the district. There are certain schools, as you mentioned. And so I think it's important that the schools have a dedicated person for this and not have it be tacked onto someone else's job. So if you have an attendance counselor, an attendance clerk who is doing all sorts of data entry and those sorts of things, they can't also be doing the really important follow-up that Ms. Williams and others discussed. You have to follow up. You have to call all the numbers that you have for that student. I was a classroom teacher. These lists are long because phone numbers change a lot, right? And you can't be doing that on top of another job that you have in that school building. It needs to be someone not only who is dedicated full-time to this work, but also has that sort of case management experience that allows them not only to identify the barriers for that student, but then to connect them with other city services that already exist to help them. So if their issue is transportation, we can connect them to better transportation options. If their issue is mental health, they need to be connected to maybe Children's or some other CDO. But the person with that case management experience can identify the problem, connect to services, and follow up. I believe it was either Ms. Williams or Mr. Boots mentioned that follow-up is key. You have to keep checking in on people to make sure that what you're doing is working. And with the overwhelm of having this SST work be on top of someone else's other job, that sort of follow-up isn't possible and hasn't, in our experience with our clients, been happening. And then you don't get the sort of meaningful work that the SSTs were designed to do.
Okay, I probably should follow up, but that was helpful. And I made a note of that. Thank you. I have one last question, and that is for Ms. Manitri. You had mentioned your fourth point was consider incentivizing 7th and 8th grade students to financially for attending class and doing well in school. Do we really want to do that?
That's a great question. I think that it is an option. So right now we are in a very interesting time where it's important to try to think about new innovative ways to address school attendance. One way I mentioned also was like the XQ partnership with DC and how they've like partnered with 2 schools to rethink how a high school should look. I think this is another avenue. And one reason why I mentioned it was because there was a previous study done here in DC by Allen and Fryer in 2011. They actually did a pilot study where they invested funding in schools to incentivize students to show up. And they saw positive gains. Like it didn't correlate necessarily with academic gains. However, it got the students to school. And so I think that it is still a possible solution to explore, even if it is just piloted. And I also think that like you could look at how that could be piloted with other organizations that I think will be testifying today and sharing more about how incentivizing students could work.
Okay. I should move on to the next group of witnesses. I want to thank each of you for your testimony. A couple of you said you would get us your statement. Looking forward to that. Thank you again. So you all are excused. I think you can continue to watch, but we're going to bump you out of the panel room and call the next group of witnesses. Thank you again. The next witnesses are Rebecca Toyin Doherty, who's founder and director of Alvena Foundation, Dr. Sharifa Holder, who's attendance support specialist at SIP-DC, Scott Goldstein with Empower Ed, Jeffrey Grant, who's CEO of Monument Academy Public Charter School, Barry Brinkley, who's chief of staff at DC Prep, Sharis Sharp, who's with Lamb Public Charter School, Reverend Wendy Hamilton, who's attendance counselor at DCPS, but I believe she's testifying as an individual, Justin Lessick, who is executive director at Sojourner Truth Public Charter School, and Sean Hardnett, who's CEO and founder of Statesman College Prep Academy. So let's begin with Rebecca Toyin Doherty. You are muted if you're talking.
Thank you.
Good morning.
Good morning.
Good afternoon.
Oh, that's right. It's afternoon now. Good afternoon, Mr. Chairman and members of the Committee on the Whole, and thank you for this hearing. My name is Rebecca Toyin Doherty, and as you mentioned, I am the founder and director of Alvena Foundation, a nonprofit with a mission to bridge the socioeconomic development gap through research-based education programs, advocacy, and technical assistance. The data on attendance, chronic absenteeism, and truancy in the district is not foreign to us. It's simple, students are not showing up. The recent DC Park and NAEP results create an imperative to accelerate student learning in DC, which requires students to be present in school for instruction and other support services. I urge you to consider funding a new approach. My proposal to conduct a pilot study on a program that provides cash incentives to students and families to attend school. This proposal stems from my years of attending Everyday Counts task force meetings, conversations with stakeholders such as students, parents, school, and nonprofit staff members, and university researchers, and my personal experience as an educator and a researcher and a DC resident. I'm compelled to speak at this hearing to urge the committee to consider another approach to addressing chronic absenteeism by investing in this pilot study called Cash for Class. We want to share 3 common questions we've been asked. First, why invest in conducting a pilot study to give cash for class? It's because decisions in education made by our government should always be evidence-based. In addition, this pilot study will build on an incentive program that Allen and Fryer in 2011 at Harvard University's Education Innovation Labs found that actually worked. 2, why do we need incentives? Well, there's social psychological research on the impact of incentives on people to induce behavior when it's connected to inputs such as attendance. Additionally, incentives are not necessarily a new approach in government. The federal government uses grants as incentives to encourage state and local governments to adopt a certain law or a new approach. Furthermore, the pandemic wiped out the gains of our reform era while affecting most deeply our students farthest from support systems available at school or who struggle with intrinsic motivation to show up to school. Third question, why should DC students and families be paid to attend schools? And here's some anecdotal evidence from our community that suggests that this program could work. An 8th grade student with nearly perfect attendance unilaterally said that cash incentives would definitely help students and families. A community resource employee at a nonprofit that supports a wide range of schools in the district said the parents he works with who struggle with attendance share a common denominator when discussing issues and barriers that affect their children's attendance, and it's money. Also, attendance counselors at different schools in DC shared the positive results they have seen from incentivizing students. School principals have also shared results in incentivizing students to select or join specific program offerings. Another research study by Harvard's Allen and Fryer, it also shows that cash incentives linked to student achievement could yield positive gains, as shown in cities such as DC, Dallas, and Houston. Fryer tested incentives in several cities with different models, and he found that what worked with incentivizing inputs were inputs students could control, which led to students developing habits that support strong outcomes later. This is especially important as we recover from the pandemic. And then from a cost and benefit analysis standpoint, the government is likely to get a higher rate of return on its investment in education when students actually show up in school. And I'll be happy to share a hypothetical during the question and answer. In conclusion, Fryer stated, incentives can be a cost-effective strategy to raise achievement among even the poorest minority students in the lowest performing schools. We urge the district government to fund this pilot study to pay students and families who attend schools with the highest truancy rates. Thank you for this opportunity. I welcome questions and hope there will be future conversations to discuss this proposal with the committee and others here today.
Thank you. Dr. Sharifa Holder.
All right. Hello, Chairman Mendelson and members of the Committee on the Whole. My name is Dr. Sharifa Holder, and I'm a former KIPP DC special education teacher, and I'm currently supporting attendance systems at KIPP DC's network of 20 schools. Thank you for holding today's hearing to continue these important conversations on how we can support every student and family in coming to school safely each day so that they can access their education. Earlier in March, we shared our plans to move towards a more restorative practices approach to communicating with students and families around attendance. Specifically, we've changed our attendance messaging to be more welcoming and less focused on penalties. We want students to get the message that we miss you when you're not here because you're an integral part of our community. We've also created conversation guides so teachers can effectively talk to parents and students about attendance in a more positive way, and parents have told us that this new messaging feels supportive. We're holding early attendance conferences that focus on rebuilding relationships with families after the long pandemic separation and collectively solving challenges that prevent students from coming to school. We're also celebrating students for even small attendance improvements, and they're very excited to become eligible for these different types of recognition. And we're expanding our attendance staffing capacity by hiring 3 new attendance specialists and using Kinvolve's two-way text communication so that families can respond directly to our notifications and let us know their needs. We want to thank the Deputy Mayor of Education for providing all DC schools with free access to Kinvolve during this school year. We're excited to share that this approach is showing early signs of success, and every KIPP DC school has seen their in-seat attendance rate increase between 4 and 17 percentage points as compared to the same time last year, and our chronic absenteeism rate has been nearly cut in half as compared to this point last year. And while this represents significant progress, there is still much more to do. We specifically are asking for your partnership in the following efforts: expanding DC School Connect, because we've seen how helpful it is to many of our KIPP DC families, and it's currently at capacity. Providing free WMATA access to parents of public school students, possibly during drop-off and pickup windows when traveling to and from school, because the Kids Ride Free program has been beneficial to many of our secondary students. But for our younger students who often aren't old enough to ride by themselves, asking a parent to pay for Metro rides every day is sometimes cost prohibitive. It continued to expand safe passage efforts because we know that when students and families feel safe on their route to and from school, they're much more likely to show up every day, and continue eliciting feedback from students and family because they know the challenges they're facing in getting to school and what would be most beneficial for them. We've been conducting empathy interviews with students and families to ask about their needs. We're hosting a student safety forum this Saturday so that our students and families can discuss safety concerns and share them directly with policy leaders. We're very grateful for the council's focus on attendance, proud of the investments we're currently making and the early successes we've seen. With your support, we know we can create an environment that encourages students to attend school each day and engage in the learning that we know will make them successful. So thank you again for allowing me to testify, and I look forward to answering any questions that you may have.
Thank you, Dr. Holder. Scott Goldstein?
Good afternoon. Thank you for holding this hearing on this critical topic. As we consider how to improve attendance in the district, we can and should brainstorm a range of strategies that directly help students ensure they arrive at school every day on time, from safe passage to school, SSTs, cash incentives, successful family engagement, and more. But there are two factors that I believe undergird whether any of those efforts have a shot at success: students' ability to attend school and students' desire to attend school. So let's tackle each one at a time. When we consider students' ability to attend school each day, we must consider students as individuals and not as a monolith. I taught both GED and later high school to a large immigrant population. Every day, many of the teenage students face choices about whether to show up to school or go to work extra hours to send money home to their families. Many native DC students face similar demands to bring in extra income. We also had many students who were teen parents struggling for childcare on any given day and the need to support their children's immediate needs, even if it hurt them in the long term as they fell behind in school. For students of all ages, a lack of stability at home sometimes means they're asked to care for younger siblings, to come to work with their parents, or staying with a relative far away from school due to family circumstances. It was common for many of my students to have at least 2 or 3 different places they slept in a given week. How they would get to school the next day was unpredictable and often interrupted by last-minute changes for them or their family. I could go on about the challenges our students face, but in short, we will not make a transformative shift in chronic absenteeism without dramatic anti-poverty investments like guaranteed income. Second, many students lack the motivation or desire to go to school each day, and much of that is our doing. First, while reading and math are critical building blocks of learning, our focus on these subjects to the exclusion of a more well-rounded education is not only antithetical to research on how students learn, but is driving down student engagement. Our obsession with post-pandemic learning loss has exacerbated this challenge. Despite all the research that strong content knowledge through subjects like social studies and science helps improve literacy, we continue to drill and kill language arts fundamentals even to older students through tutoring and extra school time. A well-rounded education that involves music, arts, world languages, extracurricular activities, project-based experiential learning is what piques the interest and continued engagement of students. If we don't start holding our system accountable to the time students get for these opportunities and the quality of that programming as much as we care about PARCC and NAEP scores, we will quite simply never increase student engagement and the resulting absenteeism. That goes for the council too. If we care about student engagement and attendance, we should have as many hearings on well-rounded education and experiential learning as we do about test scores. We must also end over testing. Any teacher will tell you they are assessing students every day in a formative manner. But if we flood the zone with centrally mandated tests in every subject area, it's nearly every single day students have tests in one class or another. And that is a frequent reason students stay home. If we want students to learn, let's care as much about learning time loss as so-called learning loss. Think back about your own experiences and the things you remember. Were they tests or field trips, projects, relationships you had with teachers, adults who took an interest in you? The education reforms we focused on this city for the past 15 years that care more about test results and the people who make money from them aren't incidental to student absenteeism, they're driving it. If the council wants to solve this problem, you should take the following steps. Make bold investments in guaranteed income, substantially increase the funding for community school models to ensure students have the wraparound services they need, conduct oversight over schools for equity and well-rounded education, push for life skills instruction in schools, fund outdoor and experiential learning, and require OSCE to include a well-rounded education index in school report cards. Increase our investment and grow your own programs for school social workers and psychologists to address the shortage. And I have some ideas about the immediate need you discussed earlier. Hold DCPS accountable for reducing standardized testing that takes time away from learning and pushes teachers away from more engaging lessons and learning experiences and drives students to hate school. Consider enrichment day models like those we've discussed for under flexible scheduling that provide students with unique experiences that promote engagement. Students cannot learn from our schools if they don't attend our schools. Teachers know how to increase engagement. Now, if the city would only let them. Thank you for your time. Unfortunately, I'm not able to stay for questions today, but happy to follow up later.
Even though you just provoked me to ask 2 questions.
I apologize, we're a little late.
Okay. Do you want to just say a little bit about mental health since you said you had some thoughts there?
I'm sorry, about which part?
Mental health.
Oh, the more immediate need on mental health professionals. So the idea I would say is, one, there's absolutely nothing that we can do to replace clinicians, right? We need clinicians and people have to be licensed clinicians, and that's very important. But there are other ways to promote student wellness of the kind that impinges on students being able to attend schools every day. One of the ideas that we've promoted is wellness coordinators. We work with several schools that have active wellness coordinators that both work on student wellness and adult wellness, and that increases both teacher morale and presence in school, and also for the same for student mental health and well-being. And those people are not and don't have to be licensed clinicians. And there's a much larger pipeline available, an immediate pipeline available for those types of positions. So even though we need the clinicians, we need to do the grow your own to do that in the long term, I would consider the position of wellness coordinator, which exists in some schools, as a short-term idea.
Interesting. Thank you.
Thank
you. Jeffrey Grant.
Greetings, Chairman Mendelson. I am Dr. Jeffrey Grant, Chief Executive Officer of Monument Academy Public Charter School, the sole residential middle school in our city. Our school is in Ward 7, but we serve scholars who reside throughout the city, primarily in Wards 4, 5, 6, 7, and 8. I appreciate this opportunity to share with the District of Columbia City Council the practices we utilize to address attendance and truancy. Monument's mission states that we target children who may be or be in jeopardy of entering the child welfare system. The adversities many students of this population face usually result in frequent and/or prolonged absences from their academic programs. And these gaps in learning ultimately result in stagnant achievement levels. The Monument model incorporates research-proven strategies that include attendance plans and home visits, with the residential component being the primary strategy. Having the scholars arrive on Sunday evenings and live on campus throughout the week ensures that a large majority of the scholars not only come to school, but they arrive to all classes on time. Yet we still have concerns due to several parents sometimes having difficulties getting the scholars to campus that one day a week. Thus, it falls on us to provide transportation to scholars who need assistance. This may be in the form of the procurement of a charter bus company services, or administrators ordering lifts and Ubers at the request of the parent. The latter approach is costly and severely impacts our budget. Yet we have taken the approach that we must invest in getting the scholars into the school or risk leaving them in settings not conducive to learning. Again, we are fortunate to be a residential school. Our latest data shows our attendance rate is aligned with the middle school sector, which is approximately 89.6%. This number is actually greater than the alternative school sector of 73.3%. So it shows that our model can have an impact. Our city cannot afford to have children living in shelters, deny them access to healthy and safe environments, required to effectively engage with the academic content. Thus, I'm requesting that the council continue to seek additional strategies and provide funding to schools to implement those strategies. One suggestion is a contracted transportation company that uses electric vehicles. We want to be mindful of climate change. This company will primarily serve families with minors who need transportation services. That's key. In closing, I wish to thank the council members for appreciating academic models such as Monument Academy, who utilizes and implements wraparound services to address not only our students, but our staff. We are partnered with Scott Goldstein with Empower Ed. Homelessness, mental health issues, and violence in the neighborhoods remain obstacles to high attendance rates. Fortunately, Monument stakeholders recognize that our model is a panacea for the societal ills that continue to plague our communities. Now, I knew I would be short of time, but I'm sitting around for the question round.
Thank you. Thank you, Dr. Grant. I don't have a copy of your statement. If you could provide that, please.
Okay, I did send it, but I'll resend it. But I will resend it. But I did send it.
Okay, thank you.
Okay, no problem.
Barry Brinkley.
Good afternoon, Chairman Mendelson. My name is Barry Brinkley. I'm the Chief of Staff at DC Prep. DC Prep is celebrating its 20th year as a DC Public Charter School network consisting of 6 schools serving in wards 5, 7, and 8. We serve over 2,100 students in grades pre-K 3 through 8th grade. We pride ourselves on many things, including our commitment to our students. So through our Prep Next program, we not only continue to support our students pre-K 3 through 8, but we make a 10-year commitment to our 8th grade graduates as they go on to high school, college, and career. I'm testifying to share how DC Prep has continued our focus on attendance since the return to school and so far this school year. First, we believe that attendance matters, and we have spent years building up habits and mindsets with teachers, students, and families around the importance of being in school each and every day. Our students with stronger attendance have improved grades, reading levels, PARCC scores, and therefore more choices for high school. Even still, we are currently working hard to build back our attendance to pre-pandemic level, which was once over 95% across all 6 campuses. Since the pandemic, we've experienced a number of absences due to COVID-19 cases. Currently, we are seeing a rise in RSV cases in addition to the ongoing COVID cases, which continue to impact attendance. With our early childhood students, we see high absenteeism due to school being non-compulsory for students at this age. We continue to work with students and families. We continue to work with families by stressing the importance of consistent attendance and helping students get in the routine of being in school each day prior to their kindergarten year. To that end, we employ a number of practices in an effort to boost attendance at each of our schools. We always ensure we are monitoring, reporting, addressing, and evaluating attendance and truancy consistent with the district and charter authority requirements. Teachers document attendance calls in our Dean's List system. Student support coaches complete truancy reports for any student with 10 plus, 25 plus, or 40 plus unexcused absences. And we work with CFSA case managers to determine the best support for these students and families. There's consistent communication and collaboration with parents to address student attendance and related issues. This includes sharing attendance goals, data, and expectations at our mandatory family orientations, daily communication like robocalls sent home to students who are absent, attendance letters when students reach different benchmarks of absences, attendance updates that are sent home, report cards each quarter, data points shared at family teacher conferences, and we use that space to identify ways we can support families. And when we don't see families in schools, we do home visits to determine ways we can support families. We ensure personal contact with each family on each day of a student's unexcused absence. Attendance is taken at 8:15 every morning. Advisors call home to inquire about a student being absent, and the front desk sends a robocall at 10:30 if that child has still not arrived. We provide a continuum of school practices and services, including meaningful supports and incentives. These include our Principal's Cabinet, which is an opportunity to celebrate individual students with perfect attendance, our Golden Clock Award, which is a group incentive for classrooms with the best attendance, and other weekly and monthly incentives. In addition, we require all families to attend a mandatory family orientation each year, where we lay the groundwork for our strong attendance. We also implement action plans and contracts with families with a high number of absences. All students with a high number of absences are added to our student support team, action planning for family-based supports. We appreciate the council's continued support to ensure we have the funding and flexibility necessary to support our students and families effectively. Thank you for your time, and I'll stay around for questions.
Thank you, Mr. Brinkley. Charis Sharp.
Greetings, Chairman Mendelson and the committee. Thank you so much for holding this hearing. My name is Charis Sharp, and I'm the Executive Director at Latin American Montessori Bilingual Public Charter School. We provide a unique educational experience to DC families in wards 4 and 5, growing this year to serve 553 pre-K 3 through 5th grade students. Our combination of Montessori and bilingual instruction provides a learning experience that builds independence and executive function skills while expanding each child's awareness of the rich cultures of our community. We are deeply appreciative that the City Council is interested in understanding public and charter schools' challenges and successes regarding attendance. We all know that the critical first step to student success is making sure students are in school. We also know that strong partnerships between schools and families are just as important. LAM benefits from a high degree of parent engagement. In addition, a significant portion of our population has considerable resources. Because of this, most of our families do not have many challenges when it comes to getting their students to school. For these families, it's more a reset of expectations and priorities after the pandemic than it is of providing specific support. I'm talking to you today about the families that do not have these resources. When the pandemic began, LAM set 2 priorities to guide our decisions about everything from when to move between virtual, hybrid, and in-person learning to how we would focus support and resources. These priorities were safety and equity, and they remain our priorities today. For example, this year, like many other schools, we are severely understaffed in our aftercare program. It's an extremely limited resource. We know that childcare is critical for most of our community, but we chose to prioritize our Title I families for the few spots we were able to provide. These come with either reduced or completely waived fees, meaning that we are in the red with this program. We know that these families are often caught in that loop. If they can't work, they have a harder time getting their children to school. If they don't have aftercare, then they can't work. Helping our families get out of this loop is a challenge we feel is worth the effort and the expense to overcome. Schools are currently being held accountable for addressing learning loss, ensuring staff,
One sec.
students.
I didn't get that. Could you try again?
Sorry, Siri thinks that she's important right now. Schools are currently being held accountable for addressing learning loss, ensuring staff and students are socially and emotionally healthy, and making sure families have what they need to get their children to school. However, all these things are also affected by the larger social systems. Schools can only do so much on our own. Attendance, especially in the wake of the pandemic, is no different. Solutions to all these pieces require collaboration and effort from all of us, no matter our role. I realize that there are resources for families about which we in our community may not be aware. I know that the city, educational organizations, and LEAs are working to identify these and help connect families to resources. However, our attendance challenges, both those faced by LAM and larger ones at other schools, can only be fully addressed as a collaborative effort on all our parts. We can really use the City Council's help with everything from identifying, connecting, and funding resources to ensuring schools feel that we have partners in this work and that it does not rest on our shoulders. So again, thank you for holding this hearing and raising up this issue as one that reaches beyond the front offices of our schools to our policymakers and beyond.
Thank you. Thank you, Ms. Sharp. Reverend Wendy Hamilton.
Good afternoon, DC Council Chair, and thank you for the opportunity to speak on a topic that is near and dear to my heart, DCPS students. My name is Reverend Wendy Hamilton. I'm a proud Ward 8 resident, a community advocate, a newly elected ANC commissioner, and I've been employed as an attendance counselor at Brooklyn Middle School in Ward 5 since August of 2016. As I wrapped up my workday yesterday and prepared to submit this testimony, I thought about the student who'd arrived at school late, noon, from an overnight stay with his dad, as well as the parent who had called to say that her daughter was admitted to Children's Hospital for observation and would be absent for the next 3 days. While I coded their absences in our Aspen database as excused, these missed days will ultimately move them closer to being designated chronically absent should they continue to accrue additional days missed. Now, technically, under the recent 60-40 rule guidance, that the student who arrived at noon could still be counted present, even though he missed half of the school day and all of the academic instruction from his first 2 classes. That doesn't seem prudent to me, nor does it bode well for him academically, and yet these types of absences occur daily. It is for scenarios such as these that I wanted to testify today and simply ask that the council and any other organization or entities discussing policy and interventions around attendance, absence, truancy, pause to consider the stories and the families behind the data. Consider that for some students, school attendance is viewed as more of a required obligation than a stepping stone to a brighter future. Consider that the obstacles that some families face, including physical, financial, mental, and material, may hinder a student's ability or dampen their enthusiasm around attending school consistently. We can put as many surface level plans, projects, and funds in place as we want to. But if we don't work towards shifting the education paradigm amongst our students and families, what are we really doing? This is by no means an indictment on all or even most of our students, but it is a pressing issue citywide that going unaddressed increases truancy and dropout potential. What I'm trying to say is the more meaningful we make school to our students in tangible ways that they can measure, the more consistently they will come to school, not because they have to, but because they want to. Cultivating community, working with partners, cash incentives, mental health, social support, wraparound services, school beautification efforts, and happy, well-paid teachers and staff are also definitely important factors in this conversation. But until we get to the root, we won't see very much fruit. We can improve the overall attendance numbers in the district, and we can reduce absenteeism, chronic absence, and truancy without a doubt. But we have to start from a place of listening to what the students and families are telling us versus what the data is showing us. Therein lies our approach to an improved attendance outcome across the board. Thank you for your time and listening today.
Thank you, Reverend Hamilton. Justin Lessig.
Good afternoon, Chairman Mendelson and other members of the council. My name is Justin Lessig, and I'm the Executive Director at Sojourner Truth Public Charter School. Sojourner Truth is the district's first and only public Montessori middle and high school. We're located in Ward 5. We currently have a little over 215 students across grades 6 through 9. And over the next few years, we'll continue to grow until we have students across grades 6 through 12 and closer to 450 students. I'm testifying today to share some of the strategies that we use at Truth to increase attendance rates and reduce absenteeism. Our absenteeism rates have improved a bit over the last year and a half, but they still remain higher than our goals. Like most LEAs across the districts, some of whom we've heard from today, we use a multifaceted approach to increase attendance rates. High attendance rates and low truancy rates are a focus at Truth for all staff members and not just one specific team. So every student at Truth has a designated teacher mentor, and this mentor is the family's liaison to the school. The individual typically has a strong relationship with the student and family, which is developed early in the year and based on goals that are both personal and academic in nature. The mentor is typically the first touch point of a family when a student is absent or late to school, and whenever possible seeks to understand the root cause, preventing regular and on-time attendance. We also have relationship-based and personalized support systems for students that have attendance challenges. In many cases, this includes wake-up calls from mentors or our student support team. Like we've heard from others, in a few cases, it even includes personal transportation support where staff members pick up and drive students to get them to school on time in the morning. When we have been able to identify specific root causes, we've invested in efforts to mitigate the challenges. So last year, for example, we identified transportation just between the metro station and our campus as a challenge for many students. So we did invest in a shuttle bus that we operate internally and drive to and from Fort Todd Metro each morning and afternoon for multiple loops. And we did see an immediate increase in on-time arrivals last school year when we began operating the bus. We've streamlined a system for early identification of students with attendance and truancy issues so that interventions can take place as swiftly as possible, and so students don't fall through the cracks. This has required daily coordination between various teams like our student support team, which has counselors and social workers, our front office operations team, and our teacher mentors. This kind of communication and focus takes time and energy, and there are lots of trade-offs that pull resources from other initiatives. We look forward to continued discussion and learning around the best ways to improve student attendance citywide. We hope the outcome can not only include high expectations, but also an approach that focuses on addressing the root causes of absenteeism and provides the necessary resources to implement shared best practices with the fidelity that it would take to really make a difference. Thank you for your time and consideration, and I will do my best to stay around if there happen to be any questions. Thank you.
Thank you, Mr. Lessig. Sean Hardnett.
Thank you. My name is Sean Harnett. I'm the CEO and founder here at Statesman College Preparatory Academy for Boys. We were indeed recognized as a bright spot school where chronic absenteeism is concerned as a result of the fact that we serve the demographic of students that is most likely to be impacted by chronic absenteeism, truancy, and poor in-seat attendance. That group is Black and brown boys, especially those impacted by poverty. We believe that a conversation about chronic absenteeism is indeed a proxy conversation about the unrelenting impact of racist ideology and low expectations where these young men are concerned, as well as the overwhelming impact of recalcitrant poverty. While we can continue to build interventions, projects, activities, engagements to address the manifestation of this original pandemic, and that manifestation is indeed boys choosing not to come to school. If we really want to change this, we have to eventually touch the root causes and core. This is what we have come to know right now. Boys come to school when their parents send them. Boys come to school when parents send their boys to school when they know that the people at school want their boys there. Parents send their boys to school when they have the mental and emotional capacity to send them. Parents send their boys to school when it is easy to get them there. Parents send their boys to school when it is safe for their boys to be there. Parents send their boys to school when they know that the boys want to be at school. And parents send their boys to school when they know and trust that the people at school will take care of or deal with anything that happens or comes up at school. At Statesman, we focus on building, maintaining, and leveraging impenetrable relationships with boys and their parents. We focus on supporting comprehensive well-being for these young men, and we focus on creating academic environments of unrelenting joy. There are any number of individual interventions and activities that we may rotate through in doing this, and I am in no way going to hold up any one of them as the silver bullet that all schools should employ to fix this problem. At the core, we find a way to say to our students and their families over and over and over again, I love this boy, he belongs with us, and we can't win if he is not here. I don't know how you legislate that, but when the boys know it, their parents feel it, and they send them to school. At Statesman, we relentlessly engage our parents where chronic absentee issues begin to appear. We are balanced, but we don't make it hard for families by punishing the boys when it's a parent issue or something that a parent is struggling with, but we don't make it easy by allowing the offering of context to become the reason why we don't ask for that boy to be at school immediately. We ask them to send them to school now, and we do whatever we can to remove the barriers, transportation, uniform, bullying, school safety, and to support families with any number of intermittent family crises that pop up. We're unrelenting about addressing mental health and social emotional well-being. We let the boys talk to us a lot about what they're experiencing, and we try to address it. I'd be glad to take any questions.
Thank you, Mr. Harden. I don't have a copy of your statement. Can you provide that?
If they transcribed it, you may get it.
Okay, that was all extemporaneous.
I have some notes.
You've been pretty good at Statesman at reducing absences or truancy. I guess you touched on a lot of them, but I guess in two sentences, I'm trying to just sort of get a summary of what you think are the strategies.
I think that what I'm absolutely trying to do, Chairman Mendelson, is not focus on strategies. I think that at every school, there are any number of strategies, and I think that it would be the biggest mistake that we can make to produce a document that says, everybody do this. What we do is we tell our parents, we love you, we love these kids, we want them at school, we will fail if they are not here, you will not win if they are not here, and we do whatever it takes. And there are some 30 activities that are on a sheet that I can send to anybody that represent some of the things that we do. But there are 50 schools trying any one or several of them where it doesn't work, and a bunch of schools where they're doing one and it works a lot. And that is because the commitment is to the relationships that we build with them and the unrelenting and very difficult work of hustling and hunkering down to make sure that we get those kids in school every day. It's not a set of activities that's going to get this done. It is dealing with the core issues that are keeping our parents from getting their kids to school and supporting them in any way that we can.
Well, what you just said sort of echoes what I was looking through the statement that Mr. Josh Boots gave. Here's what they told us works. Focus on therapeutic relationships with students and families. Sounds like you kind of were saying that. Commitment to the hustle, you just used the word hustle. Celebrating students and modeling the importance of attendance top down.
Almost everything that Josh said is in a statement I gave him. We were one of the two schools that were the bright spots that they used, and that they interviewed closely to determine what was going on in the school. And that is I am not saying what he said. He was saying what I said.
Okay. Let me ask a question of Reverend Hamilton. There were a couple of things in your testimony. One was you said that using fundamentals making school more interesting.
Mm-hmm.
And even though I agree with that, unfortunately, I don't know that there's a strategy that the council can pursue, or even that some of our educational leaders like the state superintendent or the deputy mayor can pursue to make school more interesting. That happens either in the classroom with the teacher or maybe with the school's educational leader.
Well, I don't know if I said, and thank you, Chairman Mills. I don't know if I said interesting. That's not necessarily the word I meant. I said more meaningful. I think that's the word I was looking for. And when I said, and what I mean by that is helping to communicate and reinforce for students that education is more than just an obligation, right? You don't go to school because I have to, but because I want to be there because I understand that it will lead me, to a future stepping stone, not it will prevent me or my parent from encountering any compliance issues because I'm not here. Does that make sense?
It does, but as a strategy, I'm not sure it's one. I mean, we've set up a structure where we have a school with classrooms with classroom teachers.
Mm-hmm.
And then it kind of comes down to the individual teacher, or maybe the school's principal, whether it's meaningful.
Well, I think it's all of us though, because I think those meaningfuls and those messages start with us. They start all the way, from the top down. So from the council and programming that we offer and messaging around education, benefits and incentives that you all put in place to encourage students to feel like my going to school means more than simply just showing up, but it's an opportunity for me to grow, and people celebrate me because I go and reward me. And so we can't, pinpoint one thing, kind of like what Mr. Hardnett was saying. There's not one specific thing, but I think it's around the message. We have to shift the paradigm in my mind in the city around education, what it is, what it can be, what it will do, so that the student has some kind of connection. I talked to someone yesterday, for instance, because I know you all been talking a little bit about financing, like financial and cash incentives, and those might work. Those tend to be, to me, a little bit more superficial. But let's say, for instance, we brought back career and career track, career versus college. All of our kids aren't going to go to college. I work in middle school, so I've got some 8th graders who, they might not feel like school as is meaningful for them, but perhaps if they get put into an apprentice type program that they can follow up in high school, for instance, that, hey, I'm going to be on the career track. I want to do cosmetology, or I want to do electrical engineering. So but I got started and hooked into it in 8th grade, and I saw myself experiencing something meaningful. So I want to continue on to high school, and as a bonus, I even am getting a cash incentive to do that as well. So I think the cash needs to also be connected, to something meaningful as well. But it's going to take all of us, just reiterating this message to remind our students and to drill that into them, that education is more than just an obligation. It is stepping stone to your future.
I'm going to challenge you on that on this way. You
All right.
started out your testimony by talking about a student who shows up halfway into the school day.
Yes.
How do we deal with them? Because I don't think that's about school being meaningful.
Well, that's what, but it's not about the school being meaningful. It's about it being meaningful to him, right? And how we work through that. So I'm glad you brought up that student, because guess what? He showed up at 11 o'clock today. Same kind of situation, oh, well, I slept late and, because I was at my dad's and I overslept, but hey, I'm here. And so what we're now talking to him about is, well, we're glad you're here, but how can we help you get here on time? Because simply being here, is not enough. You've missed a couple of periods of class. And so technically you're present because of the 60-40 rule, but you've missed academic instruction. So what will it take for us to help you? Is it transportation? But for him, it seems more like motivation. So that's what I'm talking about. How do we get to that student and get him more motivated to be? Because I can give him a Kids Ride Free card. I've picked up children, but if their internal motivator is not to be here, then sometimes those superficial strategies won't work. So that's what I'm talking about, is how do we get underneath that and help a student and encourage a student like him? That message is going to have to come from us. It's going to have to come from home. It comes from leadership, and they have to be surrounded with a message that motivates them and changes sort of this attitude that, well, I'm here, I showed up. School is more than just showing up.
I have one other question for you.
Sure.
Are there enough of you? So there was a witness who testified earlier that in some schools there needs to be a full-time, I forget what they call them, it wasn't attendance counselor, you are an attendance counselor, but somebody full-time who could follow up with the SSTs. Are there enough of you in your school?
And I loved that testimony. I think it was Dr. Robinette, I believe. I see somebody put in the chat, wellness coordinator. No, there's not, because as she said, most of us are I'm the attendance counselor, I'm the enrollment counselor, so I got to get the kids in the door, and I have to, monitor attendance, and several other roles that I'm working on here. And you'll see that across the city, that folks are doing a lot of different things. It would be wonderful. Mr. Boots talked about that follow-up. That is so key. If I had the time to follow up, the way I'd like to, I think it would be meaningful. Again, because sometimes meaningfulness to kids is somebody cares. They care about the fact that I'm there or not there. And you've heard that across the board in testimony today, where if a kid is convinced, sometimes they're kind of tough. They don't trust you, but if they become convinced that you care about them and you're going to do whatever you can to help them have this wonderful experience, not just because, they're supposed to be here, because we want them here, because we understand what this means for you later on. It's not just to make us happy. We're trying to help you understand this will make you happy, in the long run. So wellness coordinator, follow-up coordinators, I think every school could utilize that, because we're all stretched very thin, but it's in that follow-up. You can start a program, but if you can't do that key follow-up, that's where we start, having kids to, fall through the cracks. This kid I talked about today, thankfully, I've got partners in the school. Show Up and Stand Out with Catholic Charities helps me out. Communities in schools, I have a great attendance team. So she's following up. She's calling mom to see how she can help, Catholic Charities. And so we have, we're fortunate at Brookland to have some of those systems in place. But I think that having things like looking into something like a wellness coordinator citywide would definitely bring us some immediate tangible rewards as far as this is concerned.
Thank you.
I just wanted to add one thing to what she was saying. You asked the question, do we have enough of you? And my immediate thought was, of course, we do not have enough of Wendy Hamilton. We have enough coordinators in positions. We will never have enough of Wendy Hamilton. And I think that those of us on the latter part of this, we're talking about the deep and I want to say adaptive work that is associated with this, building, maintaining, leveraging relationships, being next to people, supporting them through very difficult times, and proving to them that their child is better with us and that their lives will be better as a result of what we're providing them. And that is indeed something that I think is going to be difficult for us to legislate around. I think we got to do a lot of talking around it. We got to do a lot of supporting of it, rewarding it, incentivizing it, and training and developing programs that can support people in replicating Wendy Hamilton. But giving somebody the role that she has 1 million times over is not enough if we don't have 1, 2, 3 of them, of her, to put in that role with that mindset.
Chairman Mendelson, may I actually chime in very quickly? One of the terms that we continue to use freely and liberally is to label children at risk. A term that I've learned since utilizing a book, Pedagogy of Confidence by Yvette Jackson, is school dependent. As a resident, 58-year resident of Washington, D.C., I've watched communities and neighborhoods evolve, where now we have many children who are school dependent due to the dissolution of the nuclear families that we did have. Now, Mr. Hartnett was on point. Reverend Hamilton was on point. When our children come to us, they are receiving information, strategies, and practices that they're not receiving at home. We become that de facto, I don't want to necessarily call it a parent, although here at Monument Academy with the residential program, we are parents. We're parents. And even in the traditional school day, we become parents. And we are filling in gaps. So when they come to school, we know that we have to make it a place that is not just distributing information that's related to academics. We're healing children. We're in essence also healing families, parents and guardians simultaneously. So what I put in the chat was, we have to start looking at the antiquated model that we call school. John Dewey, Booker T. Washington, they had conversations about it, but using the same calendar, the same time frame to actually give this lift that is much greater right now with so many different things occurring. We have to look at the time that we spend, how are we going to utilize that time on task? Are we going to implement programs that are going to give them career training? How are we going to build that into the school? There's a model right here in Montgomery County, right next door, that I'm very familiar with. It's implemented by Junior Achievement of the National of Greater Washington. It is a full vocational school where you have tech, where all Montgomery County students can actually apply to attend the school. Once you graduate, you get your high school diploma and you also get certified. HVAC, masonry, electronics, there's so many other systems. I know that we can even build out what we have here in Washington, D.C., so we can get people prepared to actually take care of themselves. Because again, we have to fill in gaps that exist in our communities. We have to heal, we have to prepare, and we also have to now hit mandates on getting our kids in the building. So let's make it meaningful, as everybody's been saying. Let's make it meaningful and prepare them for their futures.
Could I add just one last thing? I'm sorry. I think about Dennis. Dennis was one of my students. God rest his soul. He unfortunately passed away, was actually murdered in 2017. But I'll never forget Dennis, who was not a traditional learner. He was one of my 8th grade students. He was not a traditional learner. He sit in class and he just was not, lecture things didn't connect with him. And so, he was not always successful academically. But we went on a tour to our feeder high school for Brooklyn, which is Dunbar High School. And Dunbar High School has a shoe repair shop downstairs in the basement. I think he offers that as an elective. As we were taking a tour of that high school, Dennis on the tour saw this shoe repair shop, goes in. I've never seen his face light up. And he sat down and the instructor was telling him a little bit about the program and that. And I thought, wow, here's something that this student who's not a traditional learner could connect to. And he felt successful, something he could do with his hands. And I thought, if somebody like him who is trending toward potentially becoming a dropout, because we know the dropout rates are highest in the 9th grade. That's why I'm saying we need to start some stuff early. 9th grade is too late, in my opinion. We need to start around 8th grade, getting them set on a course and a track something that's meaningful that they can continue in high school. I feel like somebody like a Dennis who was excited about a program like that, knowing that he could look forward to getting into a program like that, would encourage him to come to school. It would make it meaningful for him. It was something tangible. And hey, if he wound up getting some sort of cash incentive as well, that's just the icing on the cake. So that's what I'm talking about when I say we need to make these, sort of connections for students, help them make this connection to education being more than just showing up because that's where you're supposed to be. We want you there, and we're going to expand programming and make things creative. We're going to give you a place of connection so that you want to be there, and that place of connection is going to benefit you in the long run.
This is sort of irrelevant, but was it Peter Bug Shoe Academy?
I don't know if that's the name of it, but is that it? If anybody here knows about the Dunbar Shoe Academy, but my understanding was a gentleman.
It may be. I think it may be, but I know that Peter Bug is also down at Capitol Hill as well.
Yeah, the one that do shoe repair and shine and all that, and he was fascinated, and I felt like that something like that would have resonated with him, but unfortunately, amen. Thanks.
I have one last question, and that's for Rebecca Doherty. When you testified,
yes,
you said third, from a cost and benefit analysis standpoint, and you went on and said that you had a hypothetical.
Yes, I'd be
Thought I
happy.
forgot.
Oh, great. I'll be happy to share that. So let's look at, in my hypothetical, I looked at one of the schools in DC, and that was Anacostia. So when we look at the budget at Anacostia High School, the per student expenditure for the 9th grade class can be estimated at a total of about $5,414,000. So if we look at that and we look at the 76.3% chronically absentee rate and an 84.6% truancy rate, this is school year 2020 to 2021. It is probable that the district is not getting the return on its investment on education, ranging from about $4 million, $4,130,000 to $4.5 million. And that's because when you look at education and how it works from an economic standpoint, and a budgetary standpoint, you still have to have the funding for teachers, counselors, attendance counselors, everybody, whether or not one student shows up or 100 students show up. So the irony of that is if we're not looking at other means to even get the students to show up in school to benefit from the services that the district is already funding, that the schools should be providing, then I don't want to use the word waste, but the money is not, the funding is not being effectively utilized. So that's the argument about thinking about student incentives. And I do agree with others, what's been said about making the school feel warm and welcome. Not all schools can, is a panacea. Not all schools are doing what the schools here have spoken about. But if we can get the students to show up, part of this is also increasing accountability. So there's an assumption that schools have responsibility to provide certain services, to perform certain functions. And we also need to hold schools accountable. And at the same time, we also need to incentivize the students, considering that they do have barriers to access. And that's what this is seeking to do. So we're not dismissing their argument about school accountability. Of course, schools should do what they're supposed to do. That's the school's responsibility, to design the programs, to advocate for more funding, to make the school feel more welcomed. But then let's look at what's within the student's control or within the parent's control. The student who has to stop at 3 different schools before getting to her or his or their own school. The student who couldn't show up at school because they didn't have money to wash their uniform. The student who didn't show up because they had to do somebody else's hair to have enough money to pay the light bill. These are stories that we know, we've heard, and I'm sure my colleagues here as well will attest to that they've also heard. But they know because they reach out to those students and they know those problems and they help them to address those problems. But what about other schools that don't do that? So perhaps we can also have a two-way avenue where we can incentivize the inputs that are within the students' control and also increase the accountability, the expectations we have of schools to perform their responsibilities as well. But that's the hypothetical from an economic standpoint, which we are losing about $4 million in each school when students are not showing up at of course, the schools with the highest truancy rates.
Thank you for that. I want to thank each of you for your testimony and your time. A couple of you didn't have statements. If you could provide those, I'd appreciate it. I'm going to move to the government witnesses. I'm actually going to pause for about 3 minutes, but we'll let them in. So you all are excused. Thank you again. The government witnesses are Dr. Christina Grant, who's the state superintendent for OSSI, Paul Kine, who's the deputy mayor for education, Dr. Jessica Sutter, who's the president of the State Board of Education, Cynthia Ruiz, who's chief integrity officer at UCPS, Rashida Young, who's the chief performance officer at the Public Charter School Board, Elizabeth Maffaletto, who is with the Child and Family Services Agency. She's deputy director of entry services. Cheryl Bozarth, who's interim director at the Office of Victim Services and Justice Grants, and Dana Edwards, who is case manager addressing truancy through engagement and negotiated dialogue. That's ATTEND program in the Office of the Attorney General. So I'm going to pause for just a minute while you're all being let in. I want to thank everyone for waiting. We'll begin with Dr. Grant. I have a screen full of black boxes here. Oh, there's a face.
I know, it's so impersonal. Good afternoon, Chairman. How are you today?
Fine, how are you?
I'm well. This has been such a good conversation. I'll make my remarks as brief as possible so we can get to the conversation. Good afternoon. Again, Chair Mendelson, other members present, and members of the listening public. I'm Dr. Christina Grant. I have the great joy of serving as the State Superintendent of Education. I welcome this opportunity to appear before you today to discuss this important topic that we've been discussing this afternoon, school attendance in the District of Columbia. Students must regularly attend school to maximize their social, emotional growth and their academic success. As a district and as a country, we are investing an unprecedented amount of resources into programs to accelerate learning and advance student achievement in the wake of the pandemic. But these investments are truly fruitless if students are not actively attending school. For the 2021-22 school year, OSCE conducted an analysis demonstrating that on average, every 10 percentage point increase in a student's attendance rate is associated with a 6-point increase in their PARCC English Language Arts scale score and a 4% increase in their PARCC math score. To put it plainly, we have demonstrated what should be obvious to all: regularly attending school increases student achievement, and missing school hurts student achievement. We are at a pivotal point in the district and in our nation. While DC was once the fastest improving state in the nation prior to COVID-19, we lost significant growth during the pandemic. These troubling outcomes are compounded by the fact that, as we experienced across the nation, our neediest students, those furthest away from opportunity, saw some of the greatest score declines. Everyone gathered today understand the urgency of the moment we are in. This is why we're leveraging and investing directly overseeing nearly $1 billion in initiatives such as extended learning time, high impact tutoring, expanded access to high quality instructional materials. But unfortunately, chronic absenteeism and truancy inhibit student growth for far too many students. For OSCE's reporting purposes, chronic absenteeism refers to students who miss at least 10% of school days, regardless of whether the absences are excused or unexcused. And truancy refers to students who accumulate 10 or more unexcused absences. For the 2021-22 school year, absent meant that the student missed at least 20% of the instructional day, the strictest threshold in the country. For the 2022-23 school year, OSCE updated its attendance regulations to change the definition of present from 80 to 60% of the instructional day and established guardrails for taking attendance during routine and situational distance learning. While updating the definition of present was the right thing to do, as it better aligns our practices with the rest of the country and provides reasonable flexibility for students navigating difficult commutes, we have consistently maintained that this change would only marginally affect our attendance rates. This position is supported by the data. Less than 1% of absences were for partial attendance last year. In the 2021-22 school year, truancy rates increased 3 percentage points to 42%, and chronic absenteeism increased an alarming 17 percentage points to 48%. Our analysis shows that chronic absenteeism surged as a result of excused absences, accounting for 86% of the increase in student absence in the 2021-22 school year. We surmise that this increase in excused absences was due to combined effects of COVID-19 and the return to in-person learning. DC experienced multiple surges of coronavirus variants during the 2021-22 school year, with a particularly high surge of cases in late December through mid-February. Supporting schools to reopen for in-person learning, we provided flexibilities to schools to offer situational distance learning if virus rates hindered school operations. We also supported schools' efforts to keep students and staff safe and healthy in school and virus-free. During the spike in cases last winter, DC Health's isolation guidance prohibited individuals with COVID-19 from attending schools for at least 10 days. It also required unvaccinated close contacts to be quarantined for 7 days when they were asymptomatic and received a negative test result, or at least 10 days if they were symptomatic or failed to receive a negative test. Following this guidance, schools implemented robust testing, contact tracing, and quarantining processes throughout the school year. While the increase in excused absences is certainly understandable given the circumstances, it does not lessen the impact of those absences on student learning. Any absence, whether excused or not, denies a student the opportunity to learn. We clearly need a concerted effort to improve student attendance in DC, but it is also important to place DC's attendance struggles within its proper context. Most cities and states have also dealt with sharp rises in chronic absenteeism, with many experiencing 2- and 3-fold increases. Though national data is not yet available for the 2021-22 school year, chronic absenteeism increased more than 26% in the school year 2020-21, and likely increased even more this year. The pandemic has produced direct and indirect effects that have increased absenteeism both locally and nationally. We are proud of the whole of government efforts that we are moving forth to keep students safe from the coronavirus pandemic as we reopened our schools to in-person learning. The fundamental issue is too many students are missing school without an excuse. That's why OSSE is establishing a community of practice sessions beginning in January. These sessions will bring together school leaders from across the district to highlight innovative and best practices that are leading to improved attendance rates. Leaders from Center City's Brightwood campus, which has one of the highest attendance rates in the district in the 2021-22 school year, will take part in the first session. KIPP is also initiating innovative attendance and strengthening their practices in this current school year, and they are going to be interested in supporting this community of practice effort. In addition to establishing a community of practice, as a part of our larger work to foster student and staff well-being, OSSE will add a strategic initiative to reduce chronic absenteeism to our forthcoming 3-year strategic plan. To meet this goal, we will explore establishing a systemic analysis of the roles of attendance monitors and student support teams and professional development trainings for these individuals to support students and families in improving student attendance. For the 2021-22 school year, OSSE conducted an analysis between school-level concentrations of at-risk students and attendance. Controlling for observable student characteristics, we found that, on average, a 10% increase in the percent of at-risk students in a school is associated with a 2-day increase in absences. So a student who attends a school where 90% of the students are at risk is present for 16 fewer days on average than a similar student at a school where 10% of the students are at risk. This analysis shows that we need more attendance-based supports in schools that serve higher at-risk students. Driven by persistently high chronic absenteeism in district's high schools, Mayor Bowser has called on DC to reimagine high school so that it is welcoming and a captivating experience for all learners. When students feel safe, confident in their own abilities, and can connect their learning to their career aspirations, attendance rises. In August, we welcomed an inaugural class of approximately 100 students from 8 high schools across the city to the Advanced Technical Center at Trinity Washington University, where they are taking dual enrollment classes in in-demand fields of health science and cybersecurity. The ATC will expand enrollment and capacity as it moves to a standalone space at the Penn Center next year. We are also expanding work-based learning opportunities, including the Advanced Internship Program and CTE programming at 16 DC middle schools. Though we know that students are more likely to attend class and persist through challenges when their classes align to their intellectual interests and career aspirations, improving our understanding of the push and pull factors in high schools, particularly for 9th graders and 9th grade repeaters who annually have the lowest attendance rates, will enhance and improve this strategy. Attendance is a multifaceted issue without easy solutions, and addressing it will require investments and cooperations across the government and throughout our community. Some of the most significant barriers for our students are more systemic and structural in nature and not related to the education sector. Yet, we realize that all of this work is difficult and we must be focused on it together as a city. For example, the investments that we make in public safety and enforcement of our laws keep our students safe on their way to and from school. Our investments in housing stability mean students have to transfer schools less often, and we know that's tied to higher levels of absenteeism. The district's measures to expand income equity for under-resourced Washingtonians, including the Kids Ride Free program, should also be noted, as everyday costs, including for transportation, can influence attendance rates. So while the education sector efforts are critical, system-level efforts are also key to addressing this pressing problem. It takes a state education agency committed to collecting and publishing valid attendance data. It takes strong leadership and staffing from CFSA and other partner agencies to enforce the laws and provide support to families. It takes schools and LEA leaders, many like the ones you had a chance to hear from today, dedicating their time and their resources to identify and spread best practices. It takes neighbors and parents to stay on top of their children's attendance and impress upon them the importance of regularly going to school. It takes individual responsibility from our young people, particularly our high schoolers. In some, it takes a village to ensure that our students are safe, engaged, and ready to learn every day. In closing, I do want to recognize the hard work of our school staff on the front lines, engaging and supporting our students and all of their families. Addressing this longstanding problem cannot and will not be done overnight because there are no easy fixes. But with the focus and sustained efforts of all of us, our policymakers, our school officials, community members, parents, and our students, it is a problem that we can continue to improve upon. Thank you, Chairman and Council, for your time and attention to this matter today, and I look forward to engaging in our conversation this afternoon.
Thank you, Dr. Grant. Mr. Kine, Deputy Mayor Kine.
Good morning, Chairman Mendelson and members of the Committee of the Whole, staff, members of the public. My name is Paul Kine, and I am honored to serve as the Deputy Mayor for Education for the District of Columbia. Thank you for the opportunity to testify at today's public oversight hearing on attendance, chronic absenteeism, and truancy in the district. Like the superintendent, I'm enjoying the discussion and look forward to continuing it with you, Chairman, and others. As Deputy Mayor for Education, I feel a huge sense of urgency around attendance, as attendance impacts students' academic performance, well-being, and safety. The COVID pandemic set us back in all these areas, making attendance all the more important. We all have a role to play in improving attendance, from parents, district agencies, LEAs, schools, and community stakeholders to young people themselves. The DME's role is to develop the district's attendance strategy through the Everyday Counts Task Force, to identify evidence-based district-wide attendance interventions and make sure they are faithfully implemented, to help remove system-level barriers to attendance, and to ensure there's actionable data across the system as we support joyful and engaging schools. Ultimately, attendance is largely a reflection of students' connection to their schools, a point emphasized at the DME's July community conversation on attendance. Therefore, our main priorities are supporting healthy, strong schools and students' sense of belonging in them, alongside citywide supports. These priorities are reflected in our collective work to safely reopen schools in school year 21-22 during the pandemic, and the investments we have made to support student well-being and engagement, and to close opportunity gaps in our recovery. Our investments include high-impact tutoring to provide targeted learning acceleration to students who've fallen behind, and reimagining our high schools so they are more engaging and relevant to students' college and career goals. They include expansion of the school-based behavioral health program to promote student wellness, and expansion of recreation and after-school programs to help keep students safe and engaged after school hours. We know that transit and safety issues contribute to lower attendance. Therefore, beyond Kids Ride Free, we've invested in targeted transit safety initiatives for youth, such as DC School Connect, our micro transit program, and Safe Passage, Safe Blocks, our community-based youth safety initiative. We are heartened that DC School Connect is at capacity this year, with 260 students routed weekly across 31 schools, and that Safe Blocks is serving 8 priority areas with 52 schools, with over 160 workers on the ground. While we are proud of what we've accomplished, our work is clearly far, far from over. Thanks to OSSE's robust data collection efforts, we know a lot about attendance trends in the district. We know that chronic absenteeism in Washington, D.C. showed a worrisome increase in school year 21-22. We also know which populations are most affected. For example, we know chronic absenteeism is more prevalent amongst middle and high school students, with 9th graders and particularly 9th grade repeaters experiencing the highest rates. We know that absences in pre-K correlate with absences in kindergarten and 1st grade. We know that students designated as at risk for purposes of funding and students of color are more likely to experience chronic absenteeism, and that this likelihood has increased since the onset of the pandemic. Notably, the increase in chronic absenteeism in school year 21-22 was largely driven by excused absences In a year of multiple COVID surges, these trends, while deeply concerning, are not surprising. Similar districts across the country have seen similar rates of increase in chronic absenteeism. In some cases, those rates are much higher than in the district. And I've included in my testimony, Chairman, a chart which compares DC to other urban districts, including Chicago, Providence, and Detroit, to show the parallels that we are facing alongside those cities. As we move beyond the peak of the pandemic, we are seeing some promising signs. Attendance rates in the district are improving in school year 22-23, although, as has been noted, they are not yet returned to pre-pandemic levels. By the end of October 2022, our chronic absenteeism reached 33.8%, which is lower than it was at this time last year, but much higher than it was in October 2019 before the pandemic. Of course, these aggregate numbers mask important school level differences. I will defer to my colleagues at DCPS and the Public Charter School Board to discuss school-specific interventions and bright spots, of which there are many, and of which we've already heard many this morning. Over this year, we've refined our strategic approach to attendance aligned to national best practice, specifically those highlighted by Attendance Works, a nonprofit organization focused on reducing chronic absenteeism. Our approach continues to center evidence-based practices, actionable data, removing systemic barriers to attendance, and tailored information sharing with families, and to support school-level direct interventions. Our strategy involves a set of comprehensive citywide interventions led by various agencies broken into tiers. And here I've included also in my testimony, Chairman, a slide which shows the tiers that I'm going to describe now alongside the specific interventions that are part of those tiers. These include interventions for all students, such as the nudge technology my office is funding, and citywide transit and safety initiatives. Interventions for students who are at risk of becoming chronically absent, such as student support teams and microtransit, and interventions for students who are chronically absent, such as the Parent and Adolescent Support Services PASS Intensive Case Management Program, and collaboration with CFSA, which you'll hear about in a moment from my colleagues. As part of this broad strategy, the DME manages a specific portfolio of investments around attendance. This year, DME is supporting everyday labs to provide nudge technology to schools and parents through partnerships with nearly 30 charter LEAs and DCPS, serving nearly 75,000 students across both sectors. Letters went out on November 25th to families of children at risk of becoming chronically absent. And this intervention has proven to reduce chronic absenteeism by 11 to 19% in other jurisdictions. So we have high hopes for the work here in DC. DME is also investing in Kinvolved, a communication tool that provides positive messages and reminders to families, which you heard about from our colleague at KIP. And DME has partnered with 41 DCPS schools and 10 charter LEAs, serving 16,000 DCPS students and 15,000 charter school students on that program. In addition to direct investments, the DME leads the Everyday Counts Task Force, which brings together stakeholders from agencies across the district government to discuss and address citywide attendance issues. The task force strives to ensure efficient and effective attendance work across government to reduce absenteeism. The program committee, for example, has been investigating the implementation and impact of student support teams, and will soon provide those insights to the full task force. And the data committee continues to pursue root cause analysis. In conclusion, Chairman and others, this work is clearly very, very urgent, and it is ongoing, and it requires our collective efforts. Thank you for your focus on this topic and for the opportunity to share the DME perspective. I look forward to taking your questions and having the conversation.
Thank you, Mr. Kine. Could you provide the slides separately? Even with my glasses, they're a little bit teeny print.
Yes, we'll be happy to send that over to you.
Okay, thank you. Dr. Jessica Sutter.
Good afternoon, Chairman Mendelson and members of the council and staff. My name is Dr. Jessica Sutter, and I am President and Ward 6 representative of the DC State Board of Education. I'm pleased to be here today on behalf of the State Board to provide testimony on our work on the issue of attendance, chronic absenteeism, and truancy in the District of Columbia, and importantly, on our collaboration and work with the Office of the State Superintendent of Education to establish the new 60-40 rule. The State Board remains convinced that the best way to ensure educational success for our students is for them to be in their classrooms each and every school day. Schools have spent countless hours and funds tracking absences to comply with regulations, hours and resources that could have instead been spent working with individual students and their families to address and remove attendance barriers. The new 60-40 rule helps account for the inequitable distribution of transportation resources across families in the district, reduces the tracking burden on school personnel, and allows for student support teams to better focus their attendance intervention resources on a smaller subset of students with significant attendance challenges. The State Board remains in fully unanimous support of this new 60-40 rule. In March 2022, the State Board testified on Bill 24-428, School Attendance Amendment Act of 2021, and more generally on improving school attendance and reducing truancy and chronic absenteeism. The focus of our testimony at that time was to highlight the significant and ongoing challenges in school attendance that the district has experienced for far too long, and the punitive nature of the district's previous 80-20 rule. We shared a 2015 State Board report by then Ward 4 Representative Camille Anderson titled Challenges Associated with the Implementation of the District of Columbia's New Compulsory Attendance Laws and Recommendations for Addressing Them. We also called on the executive to bring forward regulatory changes and shift to a new definition of present for the State Board's review and vote. We're grateful that following that hearing, OSSI and the State Board were able to get to work on regulatory updates at our May 2022 working session and continued that work until our July 2022 approval of SR 22-3 to approve the District of Columbia's amendments to the compulsory education and school attendance regulations. During the State Board and OSSI's work over summer 2022, the State Board raised concerns related to regulations about taking attendance via camera for routine distance learning, defining the acceptable threshold for student engagement in district distance learning postures, and ensuring that the new 60-40 rule would be less punitive than the existing 80-20 rule at the time. The State Board was pleased with the final proposed regulations presented by OSSI and voted unanimously to approve them. However, during our discussions with OSSI over summer 2022, there were a few outstanding questions and items that the board raised, which were outside the scope of that work and might require additional action by OSSI or individual LEAs moving forward. The State Board would like to note those items for the record today. Members raised questions about how grades, graduation promotion, and referrals to CFSA were being addressed and impacted by the new 60-40 rule and attendance regulations. Further, members also had concerns around how students arriving late to school, commonly referred to as tardies, affect definitions of absences and attendance, and whether current regulatory language could include specific references and language around tardies. The State Board knows that Councilmember Trayon White has also raised this issue. He did so in conversation with our members, as well as time on the council. At the State Board's November 2nd working session, members heard directly from our sister offices, the Office of the Ombudsman for Public Education and the Office of the Student Advocate, as they presented their respective annual reports. Ombudsperson for Public Education, Serena Hayes, shared that nearly 100 of their offices' SY 21-22 cases related to attendance. And in most cases, safety and attendance concerns overlapped. For instance, parents were keeping their children home from school because they feared their student was unsafe at school. Chief Student Advocate Dan Davis shared how his team has been using social media tools to provide families with necessary information related to attendance laws and policies. His office also noted a higher volume of calls related to attendance and truancy in SY 21-22, with more families requesting assistance related to attendance due to hesitancy around sending their children to school in person once virtual limit options were severely limited. The State Board is appreciative of our sister offices' work in this area, and we're glad to be able to share this information with the council. The State Board is also grateful to the Deputy Mayor for Education's office and their work on the Everyday Counts Task Force, specifically our inclusion in this work over the past few years. This important citywide effort initiated by Mayor Bowser to ensure that every student attends school every day has been an important venue for data-driven reflection on the many challenges our students face around school attendance, chronic absenteeism, and truancy. As the State Board understands, the DME has shifted its focus and work related to EDC. However, the State Board looks forward to being looped back in when EDC or other attendance-related work with the executive resumes. Recently, at our November 16th public meeting, the State Board heard testimony from a concerned DCPS elementary school teacher about the impacts of chronic absenteeism on teachers and school communities. She shared with us that teachers continue to be tasked with immense amounts of monitoring and reporting on student academic performance, but noted that many students in her school are chronically absent, negatively affecting their academic outcomes. But that in her experience, the time schools spend reviewing academic data far outweighs the time spent engaging with families of students who are chronically absent. She reflected on the idea that the foundation for student success is grounded in a triangle, with teachers, families, and communities working together, and that without one of those 3 points, student success becomes increasingly challenging. She suggested that the lack of time teachers or other dedicated school staff have to actually spend engaging deeply with families on relationship, especially with those students who are chronically absent, is having a clear negative impact on students' academic outcomes. She drew that line really clearly, and the testimony really resonated with my colleagues and I. It served as an important reminder of the deep connection between student attendance and other ongoing educational concerns in the district. We must all recognize and acknowledge that school attendance affects our young people in many ways: youth and community violence issues, mental health concerns, and the ever-noted learning loss that we know our students have suffered due to the pandemic. As an education community, we can and we must do more to support our students. We need a concerted effort to establish specific and actionable policies and programs that not only address barriers to attendance, but ensure that students view school as a place where they feel safe, welcomed, and authentically engaged every day. I want to thank the chairman and the council for this time and for continuing critical discussion with today's hearing on attendance. I'm happy to answer any questions you have at this time.
Thank you, Dr. Sutter. Cynthia Ruiz. You are going to have to start over. Every word was captured by the mute machine.
All right, apologies. Good afternoon, Chairman Mendelson,
Good
members of the Committee of the Whole, and staff. I am Cynthia Ruiz, Chief Integrity Officer for the District of Columbia Public Schools. I'm honored to speak before you today and continue the conversation about DCPS's work to improve student attendance and reduce chronic absenteeism. At DCPS, we want every student to feel loved, challenged, and prepared to positively influence society and thrive in life. To get there, every class and every day counts. Attendance is critical for student success, and we feel the incredible urgency around this issue given the attendance and academic challenges faced by our students due to the pandemic. Today, I'm here to share updates on the work we're doing to ensure our students are learning in person daily as we continue to navigate through and beyond the pandemic. We remain singularly focused on making connections with our families, learning about the specific barriers they are experiencing, and seeking to support them in a way that meets them where they are. In order to continually improve our attendance results, DCPS is actively employing the following practices this school year: targeted monitor and supportive attendance entry for attendance counselors and school-based staff, weekly senior leadership team meetings that focus on attendance data, discussing trends and root causes, and identifying collaborative strategies to mitigate challenges. Partnership with Attendance Works, a national nonprofit technical assistance expert, to host an attendance professional development series to support the whole school attendance strategies to reduce absenteeism, monitoring attendance, and partnership support for school-based attendance staff. Continued investment in our multi-tiered systems of support framework, including professional development and a strategic data-based approach to student intervention. The pilot of a new everyday labs nudge letters to be sent to families directly, and increased support for schools with high needs via our cluster support model focus. DCPS remains committed to using data to identify ways that we can best target resources to support our students and families. With our newly developed DCPS Data Analysis Center within our attendance dashboard, we can monitor up-to-date data points per school to better inform our practices and support. We are proud of the continuous work we're doing in the secondary grades, aligned with the aligned with the 60-40 rule, which allows us to provide more meaningful intervention and support. When we look at our data, we see compared to this time last year, we continued our focus on accurate daily attendance entry, which remains at 98%. Our current in-seat attendance is down slightly from 88.6% this time last year to 88.4%. Our rate of chronic absenteeism has increased to 35% compared to 33% last year at this time. And the year-to-date DCPS truancy rate is 9%, down from 10% last year at this time. We have seen an increase in compliance rates based on completing required CFSA and court referrals this school year compared to last school year. As we review the data, we recognize that attendance continues to remain low compared to pre-pandemic levels, and we are intent on continuing to invest deeply in activities which support our families in recovering from the pandemic's impacts. As I noted earlier, we have been intentional about providing an integrated approach to supporting students through our multi-tier system of support at every school. Through MTSS, school teams look at multiple data points, including attendance, academics, and behavior, to understand strengths and needs for individuals and groups of students. For example, a school that notes correlation between attendance and academic performance may arrange tutoring for those students, thereby providing academic support, opportunities for relationship building, and ultimately encouragement to attend school. DCPS is also tracking our immunization attendance closely. We are working internally with our student health services team to coordinate efforts so we are supporting schools cohesively, gauging the impact of exclusion on attendance and ensuring clarity related to attendance coding at the school level. We have conducted joint training and developed key guidance for staff, such as scenario-based flowcharts to help inform which attendance code is the most applicable to use. We will continue to collaborate with our partner agencies to provide appropriate support for our families. A good example of such collaboration is the Child and Family Services Agency holds weekly office hours for school-based staff to discuss procedures, referrals, and referral concerns, and share best practices. At DCPS, we know that we can best serve our students when we work in partnership with families, communities, external partners, and other DC government agencies. We appreciate the relations we have built with our partners in this work, in addition to CFSA, including the Office of State Superintendent of Education, Office of the Attorney General, Show Up, Stand Out, Kinvolved, DCPS Connected Schools Model, and the Office of the Deputy Mayor for Education. I would now like to take the opportunity to highlight our new and expanded initiatives. DCPS, with the support of the Deputy Mayor of Education, expanded 2 partnerships late this fall. The first partnership is Kinvolved. This partnership provides 40+ schools with access to communication application that is designed to improve family engagement and increase two-way communication with families regarding attendance. The second partnership is with Everyday Labs, which manages, on behalf of DCPS, issuance of nudge notices via mail and electronically to students who have a history of chronic absenteeism. Last summer, we also relaunched in-person relationship building after a long hiatus due to the pandemic. Educators were encouraged to meet families in person, outdoors, in the community, with all health and safety guidance considered. Families have been receptive to this. From June to September, we saw 29 schools relaunch home community visits with over 3,000 families reached. DCPS has completed approximately 4,500 total home visits so far this year across 31 schools. We are eager to continue our work to connect with students and families and learn the best way to support them through life challenges they may be experiencing. Thank you for the opportunity to speak with you about this important topic. DCPS believes that attendance is a first and critical step toward accelerating student achievement and recognizes that every stakeholder has a role to play. We look forward to working with community partners, fellow agencies, and the DC Council to ensure every student is given the opportunities and support they need to thrive in life. I'm happy to answer any questions that you may have at this time.
Thank you, Ms. Ruiz. Rashida Young.
Good afternoon, Chairman Mendelson and members of the Committee of the Whole. Thank you for the opportunity to testify at today's hearing on attendance in truancy. I am Rashida Young, Chief School Performance Officer for the DC Public Charter School Board. I want to start by thanking all our school leaders, teachers, staff, and students for a great start to the school year. For nearly 3 years, schools have served their communities under the cloud of the pandemic, and they continue to do all they can to increase attendance by supporting students and providing resources to families. As we discussed in previous years, there have always been barriers to students' attendance, including chronic homelessness, transportation issues, concerns for safety, out-of-school employment, and family commitments. Students and their families continue to face those challenges, and in many cases, these problems are even more acute after the height of COVID. Across the nation, the trends in truancy and chronic absenteeism show how the pandemic exacerbated problems. 45% of Chicago students and 48% of Philadelphia students were chronically absent last year. Most large cities also saw rises in truancy and declines in in-seat attendance. And just like DC, these thousands of students miss school for a host of reasons. Given this, there is no one-size-fits-all solution to decrease the number of students unable to get to school on time or at all. It will require a multi-pronged approach to support students, families, and schools with accessing and offering wraparound services. Due to the continuing challenges of the pandemic and surges in cases, we expected in-seat attendance to decrease compared to school year 18-19, the last fully in-person school year. In-seat attendance decreased by 6.8 percentage points from 91.8% in school year 18-19 to 85% in school year 21-22. We also experienced an increase in truancy from 28.6% to 44.3%. These rates concern us, but we also recognize that last year presented many new challenges as the first fully in-person year with COVID-19. Many families feared sending their children to school for risk of contracting the virus. They were also understandably hesitant to send children to school with any potential symptoms of COVID. And the Omicron wave greatly impacted the city in December and January, causing anxiety among families, and some made the choice to keep their kids home. Despite all these challenges, schools emphasized engaging students to ease families' anxieties about COVID. Many school leaders took the lessons they learned from encouraging attendance during distance learning and incorporated them into their current practices. During virtual learning, several schools drastically increased their engagement with families. At many campuses, leaders and teachers made weekly phone calls to nearly all families to update them on student engagement and progress. That strategy led to both increased parent satisfaction and increased student engagement at many schools. Now, multiple leaders report keeping those weekly points of contact and believe it will help with attendance. Following the height of the pandemic, schools knew students were struggling with their mental health. That increased need led to challenges engaging students and, in some cases, increased absences. For anyone, but especially for a young person, it is an immense challenge to complete daily responsibilities with the cloud of poor mental health hanging over. We appreciate all the investments Mayor Bowser and Council have made in the school-based mental health program. In addition to utilizing these resources, schools are doing all they can to support students' mental health, such as hiring additional social workers, incorporating social emotional learning into everything, and adding mental health days. Teachers and school leaders will do everything in their power to keep those challenges from becoming an impediment to students' attendance or other daily responsibilities. COVID and mental health are only two of the many barriers our students continue to face when it comes to attendance. Schools consistently cite transportation challenges and safety concerns. We hope that the return of 7000 series trains to Metrorail means students will have quicker commutes to school and that will alleviate crowding and frequency issues on Metrobus. We also appreciate all the council's investments in safe passage, and we know that families still need more support to feel comfortable with their children walking or taking transit to and from school. The smoother, quicker, and safer we can make the trip to and from school for students, the easier it is to increase student attendance. Public charter schools are committed to creating engaging learning environments and ensuring students are consistently in school to learn. They continue to innovate and find creative solutions to the challenges students face in and out of school. DC PCSB and LEAs will continue to engage in meaningful partnerships with government agencies, the council, and community organizations on these challenges, and we all commit to coming out of the pandemic stronger than before. Thank you for allowing me to testify, and I look forward to your questions.
Thank you, Ms. Young. Elizabeth Muffaletto. Ms. Muffaletto.
Good afternoon. Sorry about that.
Good afternoon.
Good afternoon, Chairman Mendelson, council members, and staff. I am Elizabeth Muffaletto, and I serve as the Deputy Director of Entry Services for the DC Child and Family Services Agency. I appreciate the opportunity to provide an update regarding CFSA's activities around addressing chronic absenteeism and supporting schools across the District of Columbia in improving school attendance. Partnership between the district's education and child welfare agencies consist of collaboration and teaming. Monthly, CFSA holds check-in meetings with representatives from DC Public Schools and DC Public Charter School Board to discuss attendance data, reporting figures, and the impact the Office of the State Superintendent of Education attendance guidance has on educators' efforts to mitigate attendance issues for the district's students and families. We have continued a strategy from last year to support school-based attendance staff with CFSA's virtual office hours. On a weekly basis, staff from any LEA have access to the supervisor of the Educational Neglect Triage Unit, and they can ask questions about the educational neglect reporting and investigation processes. Staff can also vocalize concerns about attendance issues for students within their school community and get recommendations for next steps. As a result of these office hours, we have found that relationships have been formed and school staff feel more comfortable reaching out to the triage supervisor directly when needs arise. CFSA has partnered with OSSI, DCPS, and DCPCSB to help support the district's plan for No Shots, No School for school year 22-23. CFSA updated its electronic reporting system to identify those referral submissions that identified a child's need for immunizations. CFSA provided the families that were subjects of these referrals support with understanding the law and its implications. CFSA continues to receive reports of educational neglect for students ages 5 to 13 who miss 10 or more full unexcused days of school. The intake process is conducted via the Child Protective Services Administration. CFSA employs investigative social workers who partner with CFSA's triage unit and DC schools to investigate accepted reports of educational neglect. The triage unit facilitates improved communication with schools and engagement with families to identify the underlying issues that result in children and youth not consistently attending school. In addition to the triage unit, the Engage and Connect unit expands CFSA's preventative measures to address educational neglect. The ECU assists schools with family wellness checks and outreach related to attendance, enrollment, and re-engagement of students. The unit engages with schools, families, and community-based resources. The unit meets face-to-face with schools and families to respond to referrals that present with barriers to attendance, including, but not limited to, transportation, housing insecurity, navigating immunization needs, enrollment support, linkage to community services, and to educate school personnel and families surrounding attendance reporting. CFSA is committed to being a strong member of the district's team for addressing absenteeism amongst our learners. CFSA appreciates your interest and oversight on this important issue, and we look forward to strengthening our partnerships across systems to improve attendance, outcomes, and reduce educational neglect for children and families. Thank you for this opportunity to testify, and I'm happy to answer any questions you may have.
Thank you very much. Cheryl Bozarth.
Good afternoon, Chairman Mendelson and council members and staff. My name is Cheryl Bozarth, and I am the Interim Director of the Office of Victim Services and Justice Grants. Thank you for the opportunity to testify in today's hearing and to share OVSJG's efforts to reduce student truancy in elementary, middle, and high schools in the district. Since OVSJG was last before you on this topic, we continue in our efforts to adapt to the changed environments in our schools, as impacts from the COVID-19 pandemic are ongoing. And while most students and teachers are back in the classroom, we know that attendance barriers that existed for students and families prior to the pandemic still pose the lingering challenges even now. I want to express my sincere gratitude to all the teachers, school personnel, education leaders, and everyone who has adapted to our new normal and works diligently to provide quality learning opportunity for students. I am grateful to the 9 community-based organizations funded by OVSJG to provide services to students and families to reduce truancy. There are 2 early intervention programs under OVSJG's Truancy Initiative. The first is our Show Up, Stand Out, or SUSO, which serves families of elementary and middle school youth. And the second is the High School Truancy Prevention Program that serves high schools and the feeder middle schools. Overall, these programs work to address the needs of students and their families to mitigate barriers to school attendance. And in the 2 most recent school years, this work was adapted to meet needs that were urgent, emerging, and persistent as a result of the pandemic. For example, when schools closed in March of 2020, the grantees shifted to address needs of students and families in the new remote learning environment. This included helping families with PPE, school supplies, desks for students, and in some cases, food for families who had become food insecure. The CBOs aided families in addressing internet services, tablets, laptops, and hotspots offered by schools, and connecting to other services and supports, including mental health services, housing, financial literacy programs, and educational and parenting supports. When schools returned to in-person learning, the grantees shifted again. They provided assistance with practical needs such as uniforms and in relaying information about health and safety measures schools had put in place. The return to in-person learning also presented an opportunity for adjustments to the OVSJG funded truancy initiatives. This year, CBOs are funded to provide 72 programs. That's 43 elementary school and 59 middle, high, or educational campus programs. This includes 63 DC public schools and 9 public charter schools. The eligibility for referring students in school year 2022 through 23 has been refined for all OVSJG grantees. This year, students who have accrued 5 to 9 total unexcused absences, have 3 or more consecutive absences, or were considered chronically truant based on the previous school year are eligible for referral to the programs. Additionally, OVSJG receives biweekly attendance data from OSSI and forwards that data to CBOs in order to fast track referrals. Looking at similar time periods over 3 school years, we see that referrals have improved since returning to in-person learning. However, they have not returned to the pre-pandemic levels. Combined referrals for both middle and elementary schools for school year 19 through 20 was 2,127. For school year 20 through 21, 1,465. And for school year 21 through 22, 1,895. We recognize that school and education personnel are juggling many demands and working with DCPS, DC Public Charter School Board, to improve referral rates, and with OSSI to access data. I want to thank each of these organizations for their ongoing collaboration and support. In addition to the SUSO program, OVSJG supports high school truancy reduction, with 2 grantees providing programming in 6 high schools. This is up from 4 schools last year. Additionally, the program has expanded from 2 to 3 middle schools that serve as feeders to the program's high schools. For school year 21 through 22, 507 students were referred to the program and 486 students were engaged. The high school truancy reduction program provides intensive, long-term, one-on-one mentoring and case management to students at risk of disconnection. They work to remove barriers and increase opportunities to facilitate a youth's re-engagement in school and improve attendance. In a 3-year multi-site analysis of all students in schools served in school years 17 through 18, 18 through 19, and 19 through 20, found that students, while in our program, experienced outcomes better than their peers in the following areas: 18% lower rate of unexcused absences, 10% higher in-seat attendance rates, and 7% higher promotion rates. In closing, OVSJG carries out our mission to develop, fund, and coordinate truancy efforts in close partnership with grantee CBOs. We seek to address program challenges strategically in a thoughtful and timely manner. We also work to maintain the core of the SUSO program, which is designed to offer an opportunity for students and families to address barriers to school attendance at an early intervention point and access supports and services to allow them to avoid other mandatory intervention systems. While many families choose not to engage, the intervention is still largely successful, as demonstrated by data we have provided previously. The majority of students referred to the program in 1 year are not re-referred in the following year. I appreciate the council's efforts to improve school attendance in the district and look forward to continuing to work with you on these initiatives. I'm available to address any questions you have at this time.
Thank you, Ms. Bozarth. Dana Edwards.
Hi, good afternoon, Mr. Chairman. My name is Dana Edwards, and I work at the Office of the Attorney General as a case manager with OAG's Addressing Truancy through Engagement and Negotiated Dialogue Attend program. Joining me today to help answer questions are Alicia Washington, the Assistant Deputy Attorney General for the Public Safety Division, and Dr. Dante Daniel, another Attend case manager. On behalf of OAG, thank you for convening this roundtable. When it comes to truancy and chronic absenteeism, the status quo is simply unacceptable. Far too many district children are truant or chronically absent from school. It is critical that the district address this issue with real urgency. When children are truant, it is a warning signal that children, families, and communities are struggling. If we as a city are serious about caring for our children and improving public safety, we must take addressing truancy a key focus. And to tackle truancy, district agencies and community-based organizations must work together to address the underlying reasons that kids are not attending school. These underlying reasons vary from family to family, but some common obstacles to consistent school attendance include problems related to housing, transportation, employment, mental health, childcare, and clothing. Our written submission includes a data underscoring the critical importance of this issue, but I would like to focus my time today on discussing OAG's efforts to combat truancy. As you know, OAG has authority to prosecute truant children for delinquency and bring educational neglect cases and criminal charges against their parents or guardians. But prosecution long after children have started missing school is not a particularly effective means of improving attendance. Prosecution also does not solve the underlying reason that children are missing school. Prosecution and involvement in the juvenile, criminal, and child welfare systems can have significant collateral consequences for children and their families. Under Attorney General Racine's leadership, OAG has therefore shifted to using prosecution as a last resort, and OAG now looks for proactive approaches to reduce truancy. As part of this effort, OAG has increasingly looked for opportunities to refer truancy cases to diversion programs that provide kids and their parents with tailored support services to address the root causes of non-attendance programs, like the Department of Behavioral Health's High Fidelity RAP program and the Department of Human Services alternative to the Court Experience ACE diversion program. OAG has also created 2 truancy prevention and diversion programs. First, in 2017, OAG launched the I Belong Here program at Sousa Middle School in Ward 7. The program aims to increase school spirit, provide students with incentives for attending school, and present monthly lessons led by OAG volunteers. OAG has also expanded the program to include providing food and clothing assistance to families. A year later, in 2018, OAG launched the Attend program as a district-wide diversion program for parents referred for criminal prosecution. OAG partnered with DC Superior Court's Multi-Door Dispute Resolution Division to host mediations involving the parents and school personnel. During successful mediations, the parties identify barriers to attendance and negotiate written 90-day action plans to address those barriers. Afterwards, OAG assigns case managers to provide intensive case management support to help resolve the identified barriers. This support typically includes connecting parents to appropriate community-based services. On occasion, we provide support beyond the 90-day period. In 2019, in partnership with DCPS, we expanded the Attend program to include in-school prevention efforts. Now operating in 6 partner schools, the preventative component of Attend involves a multi-tiered approach to improving school attendance. First, Attend case managers assist with contacting the families of children who are listed as no-shows at the beginning of the school year to confirm that they are transferring schools or withdrawing from the school system. Second, Attend hosts parent engagement workshops and events on topics that parents have identified as attendance barriers, such as employment, housing assistance. Third, OAG partners with other stakeholders to conduct mediations with families of children referred for 5 or more unexcused absences. Fourth, OAG's case managers work with the families post-mediation to address barriers to school attendance. Fifth and finally, OAG recently began providing a small cohort of parents with more intensive case management, including life coaching. OAG is incredibly proud of this work. It has helped move the district away from an unsuccessful punitive approach to addressing truancy to a more constructive one. These programs do indeed appear to be having real positive effects. For instance, in the first 6 months after OAG launched the I Belong Here program at Sousa Middle School, the school saw a 75% reduction in truancy. The program has also generally met its goal of maintaining a 90% in-seat attendance rate for all but one participating classroom over the years. And as for Attend, in both the district-wide diversion component and the in-school prevention component, the parties have had tremendous success negotiating 90-day action plans. In fact, the parties have successfully negotiated agreements in all but 2 instances. We have also recently begun collecting data on truancy rates pre and post mediation at our Ward 8 partner schools. And although the sample size is small, the early data points to meaningful improvements in attendance post mediation. We find this data extremely encouraging, and we look forward to continuing to collect additional data to evaluate the program's effectiveness. Of course, beyond the numbers, I could share numerous stories about how Attend's work is having real and meaningful impact on kids and families. To offer just one here, Attend assisted a mother with multiple children, ranging from toddler to teenager. During mediation, the mother identified housing, clothing, and childcare as barriers to consistent school attendance. The case manager focused on housing first because the family was sleeping on a family member's couch. During the initial 90-day period, the case manager monitored daily attendance, provided transportation to and from appointments, provided clothes for the children, assisted with obtaining identification, provided referrals to food sources, provided assistance with food stamp renewal process, and assisted the family in acquiring basic daily living items. The case manager resolved most issues with linkages to district agencies within the first 90 days. However, the case manager kept the matter open for an additional 90 days to support the mother and ensure the family followed through with relocation efforts. Overall, the children's attendance improved. The family relocated. The mother's own outlook and wellness appeared to stabilize as her family life improved. This type of intensive support has put the children and family in a much better position to succeed. Over the last 2 years, OAG has been privileged to provide this kind of hands-on support to 127 families and 188 children at our 6 partner schools. We know, however, that the need is much greater. With the council's support, OAG hopes to continue to expand these efforts. In closing, I want to thank you again for holding this roundtable. Reducing truancy and chronic absenteeism is imperative for the long-term health and well-being of district children, families, schools, and communities. Ms. Washington, Dr. Daniel, and I are happy to answer any questions.
Thank you, Ms. Edwards. So I have a few questions. Actually, I have a lot of questions, but I don't know that I'm going to ask all of them. I think the fundamental question, which I think I'm going to articulate, but more rhetorically, is that we've put a lot of resources into the last 10 years to try to reduce attendance, reduce absenteeism and increase attendance. And we don't seem to be making a lot of progress statistically. Obviously, with the pandemic, that set us back. Nevertheless, last year when schools were open, the numbers were higher than pre-pandemic. Even if you adjust, so to speak, for the pandemic, I would have thought 10 years ago when we started this that we would be much, much lower in terms of absenteeism, whether absenteeism means chronic absenteeism or truancy. So I don't know that I'm asking a question out of that because I'm not sure that it is specific enough to get a useful answer, but it sort of underlies my thinking here. Maybe where I'll start is with this question to Dr. Grant. In the report that you just put out, it says that additional supports and resources are needed for schools that serve large populations of at-risk students. That's like, well, we need to put more money into the problem. It also says that student populations, I want to make sure I get the language right. Structural conditions of socioeconomic segregation between schools create environments under which some schools are more able to meet the needs of their student bodies than others. Suggesting that it would help if student populations were more evenly distributed. Maybe that's taking it a bit too far, but let me press you on that. What does it mean? What do we need to do in terms of additional supports? And is that really what we need? And what about the geographic distribution issue? Dr. Grant.
Thanks for the question and for all of the conversation this afternoon. When looking at our analysis, it's not investing more money, it's thinking about the way we're making those investments. And so we actually heard individuals testify today about like having more attendance monitors in schools that serve more at-risk students. So it's like thinking about the distribution of the supports and making sure that they're aligned to the schools that are most in need. We could think about targeting supports for carrying out stronger SSTs, school support teams, and aligning the work that way. I think to your second question about distributing students across the system in a different way, we have several charters have adopted an at-risk preference in their enrollment process so that those students would get preferred selection in a lottery to support ensuring that students would have access to different schools across the system. And I see Ms. Young here, so I don't know if you want to talk more about how that at-risk preference is playing out in the charter sector, but it is just calling out in the data the implications of attendance or a child who attends a school where there is a disproportionately larger amount of at-risk students. And so thinking about ways that we would target resources to those schools in a different way, and also thinking about ways that we've seen in the charter sector that schools are using an at-risk preference to give preference to students so that they could have access to a different or a new school.
Well, we're thinking about, or we're talking about thousands of students who are chronically absent or truant. And the at-risk preference at the charter schools is going to address scores, maybe a few hundred, but not thousands. If the observation is that schools with a high concentration of kids in poverty are going to have a high concentration of absenteeism, and that high concentration is going to make it more difficult to deal with, I get the point. If the suggestion is that we redistribute those kids, I don't think we really can do that. I'm not sure you said that. The other piece of it, though, is additional resources. So what I'm hearing you say, Dr. Grant, is looking at the testimony earlier, the SSTs, that they're some of them are overwhelmed, and then the attendance counselors. I say that with some hesitation because I'm not sure that's the right title, but some folks who would be full-time focused on attendance and follow-up.
Yeah, the last, she's a reverend. I don't want to misstate her name, but her testimony, yes, Reverend Hamilton was not just compelling, but completely accurate. The role is attendance monitors, and it is ensuring that we have enough attendance monitors at a school that's of high need, because it is a hand-to-hand effort to do some of the things you heard surfaced across our testimonies, but what you heard from witnesses around calling home, making visits, working with families, deeply understanding all of the intersections of societal things that impact their child's ability to attend school, everything from housing to having access to food, to making sure that though we have a Kids Right Feed program, making sure that students have their card and are able to leverage systems. It's that type of work that when I say making different types of investments in schools of highest needs, it is having more attendance monitors in schools of highest need so that that work can be done truly in a student to student way or basis. And then I think when you reference, obviously we would not be able to just redistribute all of our students. One of the reasons why we the collective, we are reimagining high schools is because we want to create high schools that children want to attend and be present at, and make those learning environments places where kids are running into. I reference these things in my testimony, and I want to be mindful of time, but we have set up programs where even in a short amount of time, for example, at the Advanced Technical Center, we have a 96% attendance rate on that program that has only launched since August. And we're seeing very early on that those students who are coming from across all 8 wards, most coming from Ward 7 and 8, are making their way every single day to Trinity University's campus to have access to this unique way and approach of learning. And so again, I don't think that there is one solution that's going to solve for the issue, but we do have to keep making investments both at the school level, in the way we have new options for our students, to the way we allow students to enroll in different schools, to start to get at how we improve attendance overall. And I don't want to call other folks into the conversation, but I saw the deputy mayor nodding and I saw Ms. Ruiz nodding. And so I do want to leverage 2 of my colleagues that I know are working with us day and night on this topic.
Well, I think I'm going to put Ms. Ruiz on the spot. Because I don't think in your testimony you talked about more resources for SSTs or more capacity for attendance personnel. What about that?
That's an interesting point and an interesting question. I think Reverend Hamilton spoke spot on about it earlier. While our schools do have attendance counselors, registrars who are dealing with attendance, it would be helpful to have additional supports there. I think one of the things that I heard from even the testimonies are the wellness coordinator, right? Do we have enough staff capacity to do all of the things that are required at the school level? And that's a really good question. I didn't speak to it because I don't want to, overpromise and underdeliver. Is it a true statement from, Reverend Hamilton that she is and they are responsible for multiple things? I agree. Like Dr. Grant mentioned, how can we strategize the needs with what we currently have? And if there is available funding to do additional, of course, right, we would absolutely welcome, whether it's an attendance monitor, a wellness coordinator at the schools that need it the most. Would they be helpful? Would they be able to build capacity? Absolutely. To your point around the SSTs or the student attendance conferences, to monitor daily, to make those connections in terms of relationships, to make connections with, is it a transportation issue? Is it family housing issue? Is it maybe clothes, right? What are the connections that need to be made? And how can we strategically provide dedicated support to make those connections?
Well, what you just said made me think. A few years ago, we had a hearing on attendance. I had a hearing on attendance, and I was really impressed with testimony from the charter school sector about several schools with initiatives about buses to help with transportation. And the deputy mayor implemented, it might have been a pilot or a temporary program, but
The micro transit?
Could be. I'll go there in a second,
Sure.
Mr. Kind, but because I don't want to digress down that road yet. The thing is, we've talked about clothes in the past. We've talked about transportation in the past. We recognize that those are can be causes, and presumably we being the schools have done things to help in that regard. We have kids ride free, and yet the needle hasn't moved. But what we haven't talked about is helping with the SSTs being overwhelmed. And I can't remember, did the charter schools have SSTs, Ms. Young?
Yes, the charters do as well, and they report annually how many SSTs they have, and also provide some narrative about what barriers they have to implementing some of the strategies that come out of the SSTs, and some of the successes that they have as well. So we do look at those trends, and anecdotally, we've heard a lot of the same challenges that we've heard from our DCPS partners in terms of being able to just hold as many meetings as needed for the number of students that reach high absences.
So the problem on the DCPS side is shared on the charter side.
That's correct.
And you said some recommendations, those are in your annual report?
Some recommendations for, the schools, as part of what the data and information that we collect about SSTs, we ask them to share just the trends that they see on what has been working with their SSTs and some of the barriers. And we see some common barriers, but we also see different unique strategies attempted based on the school. Mr. Hardnett's testimony was really compelling because, mentioning and naming that they have a whole library of strategies that may or may not work as like a package for another school. That's something that we hear, is that there isn't a silver bullet for all schools, but there is a desire to see like a menu of options that might work from one school to the next that they can try with individual students.
But my question was, the PCSB does an annual report on attendance or truancy.
Yes.
Do you have all that in that report?
Yes, there is the information on the number of SSTs, some of the trends that we heard from schools on the barriers and the successes. Yes.
I'm going to come back to SSTs in a second. Mr. Kind, do you want to say more about the bus program, the microbus or the pilot?
You're referring to a pilot we ran working with the lab at DC that provided different resources for transportation. So it was either car fare or everyday, or free bus transit on Metro. And it unfortunately showed no effect on student attendance. So it was basically a pilot program that had these different treatments for families, and it did not show any results. That's not to say that transportation is not important, but it just says that that particular study didn't teach us anything.
I want to say why not, but I don't mean why didn't it teach us anything? We know transportation is an issue. Why wouldn't it have been shown to have an effect?
We don't know. All we know is that we understand transportation to be an issue. We hear about it a lot from families. We conducted that study to try to see whether or not if we were to provide, for example, car fare, or if we were to provide free bus passes for families, whether that would actually affect the students' attendance rates. And in that particular study, it did not, which surprised us, Chairman.
Yeah, it surprises me, but I'm glad we're talking about it. But Ms. Ruiz, you're not off the hook here. You're not the chancellor, so I can't say you can put the money in the budget, but why doesn't DCPS just put more resources into schools for a full-time attendance personnel, into those schools with high absenteeism, for full-time attendance counselors or wellness coordinator, or for to provide more support for the SSTs?
Sure. I think the wellness coordinator piece that was just introduced today, and I'm happy to take that back to figure out how do we potentially move forward with that if that's an option. In terms of attendance counselors, it is budgeted at the secondary level. The elementary schools levels is just a tad different based on the number of students. We do have registrars, enrollment, POCs, attendance POCs, and clerks that help with that. But right now I can definitely say that we only have 2 vacancies in terms for attendance counselors. I think you mentioned it earlier, and I believe somebody else did as well. I think it's just the SSTs, SACs require more than just the attendance counselor. We look at it more holistically. It could be academic, it could be behavioral, admin support. So while I do agree that potentially have an additional, for lack of better words, wellness coordinator to help with that monitoring, the SSTs and SACs require more people, right? We won't be able to provide an additional admin person or, the specific academic person who's looking at the data. But again, I was glad to hear today potential solutions to that. I can't really speak to how at the moment but I'm happy to take that back and figure out what could be a path forward to figure that out, outside of the attendance counselors at the secondary level, and again, the registrars, attendance POCs at the elementary school level.
I think I'm a little confused. You had said that there is funding for attendance in the secondary level. Reverend Hamilton said, these are not her words, that she was part-time with attendance and she was alone at Brooklyn Middle School.
I can't speak to Reverend Hamilton's day-to-day responsibilities, but that is a good thing to measure. I think she's saying that she does other things. She does enrollment and other day-to-day office duties, but enrollment and attendance go together. But you're right. I think she's saying, because she just focused on attendance, would be more meaningful and impactful in the work that she's doing. I agree with that 100%.
Well, and that was the testimony at the beginning of the hearing, was that the value of the SST is identifying issues or problems with a student and then following up. And if there's so many SSTs that the attendance coordinator, whoever, can't follow up, then the SST loses its value. I could phrase it differently. How is DCPS going to approach that?
I think that's a good question. I think one of the things, or good flag, one of the things that we have noticed is even with the 60-40 shift, we've seen a decrease in the need to have SSTs, SACs. So while haven't moved the needle, to the level that we would want to, I think we're moving in that right direction. I would also say, and going to slightly speak on it, is that we hear you. We took that feedback from last spring. We took that feedback from the DME and over the summer, and some of the, info sessions that we've had. How can we make, or how are we looking at the SACs and SCTs to make them more productive. So what we're doing this school year is we're taking a deeper dive of that. We're looking at that and seeing what is working and what's not working. One of the things that we've heard even today that I can speak to it, and I think Reverend Hamilton could speak to, is some of the challenges look very different across the board, right? Post-pandemic, and looking at what is happening now with our families and how can the SACs be more helpful to push that work forward. So what we're doing is we're working with the DME to kind of do a pilot and look at, at 9 of our schools and do a data sort of digging deeper to figure out what is working and what's not. I think what you're asking are really great questions. And we took that feedback from you last spring and some of the conversations that we've had over the summer to figure out what could be our path forward. In figuring out, yes, we've shifted from 80-20 to 60-40. Now there's less that we have to do in that area. And how can we be more thoughtful in the interventions, turnaround time, or what is working well to then implement across the agency.
Well, the construct that I'm going to claim that I helped to set up years ago was that we have these requirements around attendance, meaning that when the kids miss so many days, then there's the SST, and if they miss more days, then there's a referral if they're young enough to CFSA. And the idea here is to identify on an individual basis what's going on. If we identify what's going on, that a kid is missing school, then presumably there's something we can do. It's a big government. It might be mental health, it might be transportation, whatever. I don't know an alternative to that construct. And yet we are not reducing truancy. And so I'm struggling either with what's the alternative, and I'm not ready to bag the construct that we have. What's the alternative? Or we have to do more to make sure that these referrals are effective. And when I say referral, it's a referral to the SST, or it's a referral to CFSA, or it's a referral to court social services, or I'm looking at the Attorney General folks. Either we make the referrals more effective or we find an alternative, and I don't know an alternative.
And I think what you're speaking to, the alternative, is the work that we started 2 years ago through our MTSS framework, which is, yes, after the 5 days, is there a student attendance conference? Yes. And to your point, after the 10 days, there is a referral that happens to CFSA. And I know, my partner agency can kind of speak more to that referral process, but through the MTSS framework, we are looking at different data points. So is it attendance? Is it academic? Is it behavioral? And how do we provide supports? And I think, and I mentioned in the testimony, if it is academic and that is impacting attendance, are we providing tutoring support? To your point about behavior, is it mental health supports? Trying to figure out the root cause for that particular student. Because, I think we're all mentioning not one thing fits all. So really trying to do, especially post-pandemic, the challenges are just either different or more heightened. How do we better meet our families where they are to support our students?
Well, I'm looking at page 30 of the OSSE report, and the first line is Smothers Elementary School. And if I'm reading it correctly, 21, 22, 20. 64% of the kids were truant in 2021, 2022. That school's got to be overwhelmed with dealing with truancy. That's not the only high number on that page.
I agree. And I think if we're looking at the data from last school year or the previous school year, a lot of that could have been COVID related. I'm happy to take that comment back and figure out some of the root causes. I don't have that report in hand just now, but you're right. Those are things that I know schools are looking more into. And again, through either the student attendance conference or the MTSS meeting, trying to connect the dots for families to provide services and supports that they need.
Yeah, well, what I'm getting at is the overwhelm, and it can't be COVID related, because if it's COVID related, then it's an excused absent. absence. And so you could be
Sure.
chronically absent, but like at H.T. Woodson, the number I have here is 89.7% truant. That's almost every kid in the school was truant. And that's not COVID related. And if they're truant, then there should have, of course, that's high school. So, there still would be an SST.
That's correct.
So, and if I remember correctly, that school's got like 500 kids. So that's 500 SSTs. That's just got to be overwhelming. And so I don't think I'm getting an answer, but maybe that's because there isn't an answer. And that is, we've got to figure out how to make these SSTs effective. They can't be effective when they are overwhelmed. If they're doing 3 SSTs a day, I don't remember how many days are in a school year, but if they're 500 SSTs, maybe that's 3 a day. And actually they're sort of backloaded in the school year. And they don't have a full-time or a couple of full-time people. We're kind of wasting our time with the SSTs.
Chairman, may I make an observation?
Yes, please.
So firstly, I want to share with you, I agree with you 1,000% that we have to ensure the referrals are more effective. And I also think the reason we are partnering with our colleagues on this call to look more deeply into the SSTs and their effectiveness is to figure out what additional capacity specifically might be required or what practices we need to help schools implement there. I will say that I was struck with the witness testimony by a couple of very, very powerful statements. One of them came from Dr. Holder at KIPP, who basically said they have dramatically improved their chronic absenteeism rates. And she basically said they did new messaging, they do earlier conferences, which I think gives us some clue about the SSTs. And also they've hired 3 new people to focus on attendance. And so in terms of beginning to get some answers to I think the good questions you're asking, I think we've got some important guideposts in our system already.
Good point. And you're also reminding me, though, of Josh Blutz's testimony. And I actually am a little amused because when I asked Sean Hartnett and he wouldn't volunteer anything, and then I read to him Josh Blutz's summation, he said, that came from me. Focus on therapeutic relationships with students and families, commitment to the hustle, celebrating students, and modeling the importance of attendance top down. That didn't cover the point you just made, which was that KIPP hired some additional folks.
Well, I would share, I actually think the commitment to the hustle is one which requires us to examine our capacity in schools. So first and foremost, I think all of us do spend a lot of time in schools, and we see amazing teachers and amazing administrators doing a lot of work on attendance and family outreach and greeting people at doors and doing all kinds of wonderful things. So this conversation, I think, should in no way diminish the amazing work that is happening. I do think we have to see whether or not schools have the capacity they need to put in place these practices that we know are effective. So in a sense, we're talking about 2 different categories of work. One is the practices that we know work, including these school-based attendance teams that look at data, identify families early and often, make assignments about who's doing what kind of outreach, make sure that outreach is done, and so forth. And secondly, Sean Hartnett, I think, is brilliant on this topic. He has a 9% chronic absenteeism rate, 9%. It's extremely low. And he's got a culture, if I can use that word, in his school of love and belonging that we have to pay attention to. Like, that's not just something we should say, oh, isn't it great that Sean loves on his boys so much? But that's a set of cultural activities, again, to use that term, that we have to figure out how to ensure happens all over the place. And by the way, that doesn't just exist in Statesman. I see that in classrooms and schools all over the city. And we have to figure out together how to ensure that feeling of belonging lives across the system more deeply.
I don't want to take away from that point because I think that's an important point. That's why I'm pausing. But the first part of what you said, which was to figure out if schools have the capacity, I think we assume that they don't. And so then what do we do differently to give them that capacity? I mean, I think it's pretty safe to say that schools with a high concentration of at-risk students do not have a full-time, sole-purposed attendance person. And if they do, it's one, and they may need two or three. I think that's pretty safe, that they don't have the capacity. So how do we give them the capacity? It almost might sound obvious what the answer is, but I'm not sure it is. There was another question percolating here. The testimony from Ms. Bozarth. You said referrals have improved. However, they've now returned to pre-pandemic levels. That's not really the point here. You said, gosh, I don't have the numbers quite in front of me, that you had these statistics that the referrals were higher than the engagements. Do I have that right?
I'm not certain what you're referring to.
I'm assuming that these are referrals to show up, stand out.
Well, we're talking about both the programs. I'm not sure which one you're thinking about right now, but referrals to SUSO for the school years that I spoke of, is that what you mean? For 2020, yes. 2021, is that what you're talking about?
Yeah, but it's my question really is at the fact that you do a referral, but that doesn't necessarily mean that the family engages with the CBO, correct?
That is correct.
And that's what I want to explore.
Okay.
The engagement was fairly high, but it's like 80 or 90%.
Not sure where you're getting 80 or 90% engagement.
I'm not sure either. My recollection was that it was something like you had 1,895 referrals last year, and you said something like 1,600 or 1,500 or 1,400 actually engaged.
I don't see that in my testimony.
Well, do you know how many engaged? Let's try that.
How many engaged in which year and for which program?
Let's try show up, stand out.
Okay, for SUSO, and you want engagement for which school year?
21-22.
21-22. Hang on a second. I'll pull that up if I can right now for you. For 21-22, looks like 22% engagement.
22%?
22%.
I'm a little confused. Now I'm mixing programs here because that was show up, stand out. And maybe you were, because I turned the page here, that's where the number was. Maybe you were talking about the high school truancy reduction program. 500 students were referred and 486 engaged.
Oh, that's a different program. That's the high school. Yeah.
Okay.
Okay. So what's your question about that one?
Well, so actually the number on show up, stand out, I think is more important here.
Okay.
The whole point of show up, stand out is that these kids get some intervention. And if only, did you say 22% engage?
Yes.
This is going to sound harsh, but that's helpless. How do we change that number? Or I could ask this question, do we make it mandatory?
Do we make the SUSO program mandatory?
Yeah.
Yeah. The SUSO program is designed to be voluntary, right? So it's an early intervention voluntary program. If we are going to change that, then it's no longer the same program. It becomes something different.
Is that bad?
I can't say whether that's bad because I don't know what that is that we're changing it to.
That we make it mandatory.
Making the SUSO program mandatory?
Yeah.
Yeah. See, I the way that I can answer that is to say that it's our belief, my belief, that the SUSO is designed as a voluntary program. Making a voluntary program mandatory changes the nature of the program itself. The decision that is a decision that should be made, if it's going to be made, between the schools, the communities involved, the parents, and to look at what's really needful. And we're still going to need something at early intervention points. And right now we have SUSO for that.
Yeah, I'm feeling a little frustrated with your answer, to be honest. The goal here is to figure out how we reduce truancy or how we reduce absenteeism. We have a program, we're spending millions of dollars on Show Up, Stand Out. And we have, in my view, a huge truancy or absenteeism problem. And Show Up, Stand Out is dealing with 22% of the kids that are referred to it. I'm assuming not every kid is referred, even though ideally every kid would be. So of those who are referred, we're dealing with only 22%. So we're missing what, 80%?
Yeah, we're missing 80. You are correct in that math that we are missing.
How do we get interventions to them? And I'm reminded of testimony at the beginning of this hearing where some of the witnesses said we shouldn't take a punitive approach. We don't want to take a punitive approach, but we need to be able to intervene.
So my response to your commentary and your question, as I understand it, would be a couple of things. The first, we're currently working with the SUSO grantees and those CBOs to improve that engagement rate. The 22% is what we had last year. That is the answer for last year. That doesn't mean that's where it'll stay. If you read further or saw further in my testimony, there are some interventions that we've put in place this year to improve the SUSO and high school truancy programs. So those things are ongoing. That's one part of it. I can't say definitively if making SUSO mandatory would improve engagement rates or not. But what I can tell you is that making SUSO program mandatory changes what SUSO is. It's no longer SUSO if it's mandatory because it was built on a voluntary model.
Chairman, may I offer one quick observation?
Yes, please.
I would just share with you, I think we have got to look at the side of the equation that you're looking at now, which is, I'll call it the accountability side. I was in I don't often like to speak in anecdotes, but I was in a school earlier this week. I was with one of the school leaders I respect most in the city. And I was talking about this question of attendance and chronic absenteeism. And her observation was she did not think the families whose homes she was regularly visiting felt any accountability for ensuring their students were in school. Now, I don't know how widespread that is, but I do think this question of where are students referred and what happens to them, are there voluntary versus involuntary programs, is important for us to look at, which is part of what we're doing this year. That's alongside all of the extraordinary supports and help that we have to provide also. But I do think you're asking, in my opinion, exactly the right question about, where are folks getting referred to and is it mandatory and what happens to them in those circumstances while we are providing the extraordinary supports that are required to help students be in school and reducing the barriers.
Well, we're spending millions of dollars on Show Up, Stand Out. My recollection was it was several $1 million 10 years ago, and we've expanded the program and costs have gone up. It does get to be kind of mandatory when the referral, if you're under 13, is to CFSA. And there are a whole lot of folks who would rather that there was no referral to CFSA because of the stigma. which I don't think is the right way to approach this, but nonetheless, there is that reality that people think there's a stigma. Well, if we just leave it voluntary, I mean, in my view, it's not good enough if the engagement rate, if the engagement rate doubles to 40%, which I highly doubt would happen in 1 year, that's still 60% of the kids, 2/3 of the kids are not engaging. And the next step is, or maybe the first step, I can't remember the order, is the SST, which is overwhelmed. And then there's the CFSA, which several people nodded, with all due respect, Ms. Muffaletto, because I do love you. People want to avoid. So
making the SUSO program, in my view, making that program mandatory in order to enhance accountability, if that's where you're thinking you're wanting to go, it moves up that mandatory step just closer, right? So the SUSO program, as it was designed, was meant to be an earlier intervention that wasn't mandatory. So then we would need to look at, if it's not, SUSO is now going to be mandatory, then what are the even earlier interventions that are not mandatory? So I believe that there's an opportunity to have a full range of services available at different points, some of them mandatory, some of them not, like SUSO. I also can honor and recognize that the SUSO program engagement is not at a level that is good. And we're actively working with those CBOs to increase that engagement rate however possible.
well, let me say that I'm hearing from you an aversion to something being mandatory and a preference for something being voluntary. And I don't know that that's the correct way to look at it. Let me put it this way. There's another way to
I'm
look
not expressing an aversion.
Okay, well, let me say this. I think a way to look at it is that Show Up, Stand Out, because it works with these community-based organizations, provides, or there's the opportunity to provide a range of services. So kids missing school, the parents actually do decide to engage with the CBO through Show Up, Stand Out, and the CBO looks and says, hey, we can do some mental health, or we can work with transportation or whatever. The referral that is mandatory that comes a little bit later is CFSA. And while they can provide services, they're not quite as, I don't think of them as being quite as nimble as a CBO in terms of what they can do. And so I think that's a way to look at it, is that Show Up, Stand Out is an access to a range of services that doesn't come later, when it's CFSA coming in to see whether there's abuse or neglect, or maybe to be able to provide some help.
I don't know that we're disagreeing. I'm not trying to express an aversion, if that's what you're hearing, to a mandatory program in and of itself. That's not what I'm trying to express. I think you have an accurate and complete understanding of how the SUSO program works and the nimbleness of it. And I think that if that program is determined that it should be mandatory, that decision be made with school officials, the community, the parents. But as it stands, it's not a mandatory program. And it's not designed to be that way. And so we're not holding people accountable to a mandatory program.
Let me turn to Ms. Muffaletto, since I mentioned you. In your testimony, you mentioned these weekly, weekly office hours.
Yes.
How large is the participation?
It varies from week to week. We have about 3 to 4. So there's a separate office hours for the charter schools and a separate for DCPS that they can log on at any time during the office hours and receive that one-to-one consultation with our triage supervisor. In speaking with him, it's about 3 to 4 schools per session. But he did want me to report out that once that initial connection is made during the office hours, the school personnel that are participating feel more comfortable reaching out to him directly outside of the office hours. So it's a continued collaboration throughout the week.
So you do this all year?
Yes,
So that's 3 to 4 schools
during the school year, yes.
each week?
Yep, that's what's being reported as participation.
And that would be 3 on the charter side, 3 on the DCPS, since you said that they're separate.
Yes, Chairman.
You used to at these hearings, and when I say you, I mean CFSA, discuss whether you were finding instances of neglect, abuse or neglect. Are you
Yes.
are you still finding that? I know it's not a large number of cases, but it is an important aspect of this.
So I can get those numbers. Are you referring to the educational neglect referrals in general, if they've been
No,
substantiated?
I'm referring to the the absenteeism referrals.
Yes, I guess that's what I'm asking. Are you asking for the numbers for those that were screened in to be investigated?
I'm hesitating because what I'm really looking for is the number that comes after that, which is the where you actually substantiated abuse or neglect.
Yes, I can get those numbers for you. I don't have them directly with me. I can say, though, that I am happy to report, and I did share this with Dr. Grant and Deputy Mayor, that the number of referrals that have been made to CFSA this year as of November 15th, in comparison to last year, have gone up. So the reporting numbers have gone up, but the number of referrals that we are actually having to move forward to investigations has dropped drastically. And that speaks directly to the work that our Ed Neglect Triage unit is doing and our Engage and Connects unit is doing with the community and the schools. So just to give you a comparison, this time last year, we had 208 open investigations for educational neglect, as compared to this year, we have 65. So the number of families that we're able to engage and connect with the schools and triage have gone up, which means there's less families that have to be involved with CFSA, which is our goal.
I'm sorry, say that last point.
Which is our goal, is
No, before, what is your goal?
to have
Number?
less families involved with CFSA for a formal investigation, and to be able to meet the needs of the families and the school by connecting them prior to investigation having to be opened, to ameliorate those attendance concerns.
So you mean, does CFSA do some work with the families when they're referred?
Yes, that's our triage unit and our Engage and Connects. So that's our preventative work that we do with the school and the family when our referral is made to the portal, to see if we can somehow engage the school and the family together to ameliorate whatever attendance issue is preventing the child from coming to school regularly.
Okay. Let me see if I have some other questions for you. This is not relevant to truancy and absenteeism, but have you gotten any referrals yet based on the no shots, no school?
Yes, and I do have that information to provide for you. We actually had only 18 referrals as it relates to concerns for lack of immunizations. Of those 18, 14 were able to be resolved via the Ed Neglect Triage unit. 2 were resolved through our CFSA Engage and Connects unit. And 1 was sent for an investigation to further try and see if the family, what other, it couldn't be resolved within the educational neglect triage. And we felt that an educational neglect investigation needed to be open to further see what issues were happening with the family. And that remains open. So I do not have a disposition on that. I believe the family, I did look into the system today, and I believe the family is trying to apply for a religious waiver.
Now, I hate to say this, and this is an educational hearing, but you said there were 18 referrals and your numbers add up to 17.
So, and I had, so the referrals, I'm sorry, are per child. That one referral has 2 children listed. I should have explained that before, I'm sorry.
Okay.
But that was impressive math, Chairman.
And I did just want to highlight CFSA's approach to supporting the No Shots, No School enforcement. They've worked very closely with schools to provide support in advance of getting to a 10-day exclusion mark. And I do think that that is why she is able to report these numbers and have such a level of specificity around what's taking place with families. And so for the purposes of this group, did want to publicly thank CFSA's support, outreach, willingness to be flexible, because the goal is to keep as many of our children as possible in school, and they are really helping us achieve that goal. So just wanted to say thank you.
Thank you, Dr. Grant.
Dr. Grant, in your statement, you referred to a community of practice, which I thought I understood. And then I said to myself, what exactly does that mean?
Thanks. So a community of practice, it's literally term, it's a function of term. Educators or practitioners, we come together in community to solve real-time problems or problems of practice that occur in the work. We've been leveraging these communities of practice or PLCs at least since the time that I've been here on a range of topics. When we were reopening schools, we had communities of practice. When we were navigating COVID and how we were testing our students, test and return, all sorts of types of conversations. We've brought together communities of practice to engage in that conversation. We will now, January 17th, I believe, is our first community of practice on attendance. We will now be stepping back with schools to do more of what you heard Mr. Hartnett reference today, bring schools together so that they can hear from each other in real time. How are they navigating, providing supports for their schools? And so we're excited that we are going to be shifting our conversations and communities of practice away from COVID, but we're moving toward keeping that same practice in play for this topic of attendance. One, obviously, because it is a very, very urgent conversation, but we've also added this focus to OSCE's strategic plan. And so we want to be the driver and convener of conversations amongst all of our LEAs on the topic. And our schools are eager and excited to engage in the conversation.
Okay, thank you.
You're welcome.
Mr. Kine, you have a vacancy in your office right now for the truancy coordinator?
I think you might be referring to the vacancy we have had for our K-12, our Director of Strategic Initiatives for K-12, who historically has been the person who has led the Everyday Counts task force.
Okay.
And that position has been filled, and that person is starting on December 12th.
All right, that answers that question. Will we all like that person?
Very much.
Okay. And Mr. Ruiz, I had a parent recently say to me that her child, she was talking about her child being at one of our DCPS schools, and some, how do I put this, not all attendance data or absence data was being recorded. I don't remember the specifics, and it doesn't really matter. My question is, how do you know that the data that you're getting from the schools is accurate?
That's a good question. Do you mean if a student, like, how are we processing the data, like into the Aspen system? Like, coding attendance? Which part of it, or is it like the
Quality
attendance
control, I mean, you don't really know how many kids are what kids are not at Flora Henley Elementary School today. You're relying on the school to tell you. How do you know that what they're telling you is accurate?
Sure. I mean, we do, like you mentioned, we do monitor the attendance entry. We do provide professional development and guidance. We are relying on teachers, if they see the student in the classroom, to properly report that. And then each school does have the attendance POC, like I mentioned, that takes in the notes, the excuse notes, to update the system accordingly. If a student is absent, whether it was, illness, religious holiday, and updating the notes to reflect the system. I think there are a couple of steps there. I would be interested in hearing more about that particular parent's concern, or is it because updating it to be excused, let's say, takes a couple of days for that to process. I do wonder if that was the concern from the parent. And if you do remember the school or the parent, please do let me know. We can look more into it. But in general, there is sort of, we monitor the attendance entry. We do work with our teachers and staff with professional development and providing appropriate guidance to ensure that attendance is being done accurately and with fidelity.
Give me just a second here.
Sure.
I want to ask the folks from the Attorney General's office a couple of questions. How many students are in your high fidelity RAP program, if you're still doing that?
We're gonna defer to our deputy if we can. Do you all know our exact numbers? We'll have to follow up and find out the exact numbers regarding that so that we can be specific.
Can you give me a sense? Are we talking about 10 or 100 or 1,000?
Is there a range? We don't know. We can't confirm that right now, Chairman.
How many are in the ACE program?
Yeah, supplement. We'd have to check those numbers as well.
How many are in the ATTEND program?
We have about, the last time we checked?
Currently, we serve 127 parents, which equated to 188 children.
That's currently.
Yes.
Let me see. You have another program called I Belong Here. Is that a fourth program?
Yes.
Do you know how many are in that program?
Last program that occurred, there were about 12 students that were present. I actually attended that. I belong here at Sousa Middle School, Sousa Elementary School, excuse me. Yeah, that's about it.
Is Sousa the only school that it's at?
Yes.
And is that current, or there's none right now?
We have not continued into the school year, Chair.
Okay. But you was there last year. I wanted to ask you about that. In 2021, the truancy rate at Sousa, which is when you had this program, was 31.9%. I'm reading this correctly.
2017. Yeah.
It was 31. It was 31.9% last year in 2021, and that was 2 years ago, and last year was 68%. That feels like the needle's moving in the wrong direction with this program. Maybe I shouldn't say with this program, in spite of this program. But then it sounds like you've discontinued it.
To our deputy. Oh, I can move over.
Good afternoon, Chairman. My name
Good
is Alicia
afternoon.
Washington. I'm the Assistant Deputy. And yes, the numbers did go in the wrong direction. However, that part of that was due to the pandemic and us coming from the pandemic. So we are not focused on the numbers from during the pandemic and right after the pandemic. What we're focusing on is revamping the program while since we are back in school, in-person schools, and now we can focus on how we can best address the needs through our I Belong Here program. We do know from prior to the pandemic that it was very successful, so we have no reason to believe that it would not be successful now that we're back in person. So once we start up the program again, we have every reason to believe that it will be successful as it was previously.
This is I Belong Here, and it was only at Sousa. And
That is correct.
you're looking at revamping it for next year.
Right, we are looking to re-engage because now the students are back in school. So we are looking to re-engage with the students, have guest speakers in the classroom. That's part of the program, having guest speakers in the classroom, giving them incentives. The program really thrives when the students are in school. So now that, again, the students are in school, we are looking to re-engage with the school and to continue the program as it was prior to the pandemic.
Okay. If you all could get back to me with regard to the high fidelity and ACE programs, the participation.
Mike is up. Yes,
I
we
would
will.
appreciate that.
Chairman,
Yes.
I'm sorry, my team got back to me to your question, how many families were substantiated? Of the 65 reports that were screened in, only one family was substantiated for educational neglect.
Okay. Now I've lost where I wrote those notes. I don't think I have any other questions. Let me just ask Deputy Mayor. I don't usually end the hearing this way, but did you have any closing thoughts given all of this conversation?
Very kind of you to invite some observation. I would just share again, Chairman, how enthusiastic I was about a lot of the testimony and actually about this overall conversation. I think this is extremely hard work. And as we've said, there are practices we have to make sure are happening in all of our schools. We've got to make sure the referrals are efficient and effective. But there's also this work we need to do to ensure this sense of belonging. And I think there's a lot we can do together on all those fronts. And I think we learned a lot today from the witnesses, and I think from the conversation you've just been facilitating here. So thank you for that.
Thank you. And I do want to say, I think the charter schools have always, because there's such, what do I say, variety among the schools, that they always have some interesting approaches. And I appreciate Ms. Young, if you could take it back to the leaders from those schools, that I thought their testimony was very helpful.
Absolutely, I agree. Thank you.
Dr. Grant.
Chairman, I just wanted to extend a thank you to yourself and to our board president, Dr. Sutter, on the work that we did to change attendance codes. I know it sounds wonky, but we did engage in a robust conversation last spring with Councilmember White and the work around shifting to the 60/40, and we did tweak lots of other things in our attendance policy, the creation of codes, the capturing attendance 3 times a year. The data side of this is critically important, and I did want to make sure I thanked President Sutter for her collaboration, the work with the board. We had 3 different working sessions to achieve the vote in July, and so there's much work to be done, as Representative Sutter mentioned, but I did just want to note in front of you that we will continue to have stronger data on this topic because of the work that we've been able to achieve with our state board under your leadership. And so just thank you.
And Dr. Sutter, forgive me, I don't think I had any questions for you.
That's okay. I learned a lot listening in today.
All right, that's going to conclude this hearing. Thank you all for your testimony. As I indicated at the beginning, the record will close at 5 p.m. on Wednesday, December 14th, 2022. Time is 4:06 in the afternoon and this hearing is adjourned.